She eats like a bird. She barely leaves the house.
I am not depressed, Mom.
She's reading the same book over and over.
She's depressed.
I'm not depressed.
Okay, no one should make decisions for you to say whether or not you are depressed or aren't depressed, especially if you're clearly stating that you're not depressed. We use objective tools like the PHQ-9, which is a scale where a patient answers questions about their current state of mental health, and from there we can make a diagnosis.
I may switch you to Zoloft or Lexapro, and twice a day instead of once.
This is just not the way a doctor's visit surrounding mental health or even depressive symptoms should go. It should be more of a conversation with just the patient and the doctor. The mom should leave the room. It's about getting an intimate knowledge of the patient's situation, how they feel, what's going on in their lives. Are they having any negative or distorted thoughts that are really destroying their current feelings?
Have you been going to that support group I suggested?
Yeah, it's not my thing.
Support groups can be a great way for you to connect with people who are
What?
on the same journey.
Support groups are a very positive thing. A lot of times when you're feeling down, depressed, having some sort of distorted thoughts, what ends up happening is you feel alone. And by going to a support group and seeing that other people are going through something similar that you're going through, perhaps sharing their stories of success or even stories of difficulties, that connection, that sort of hive mentality that gets triggered actually helps release some positive neurotransmitters, release some endorphins, allow you to feel closer to other people, thereby decreasing the severity of the depressive symptoms.
I'm Hazel. Thyroid originally, but now with quite the impressive satellite colony in my lungs.
So what she's saying is she initially started having thyroid cancer, which then metastasized, meaning spread to her lungs, thereby necessitating the oxygen that she has in the nasal cannula there. The most common types of thyroid cancers are actually very benign. The 5-year survival rate is quite high in them. And the most serious thyroid cancers, while they're the rarest, are some of the most devastating cancers that you could develop in the human body.
And that was my life. Reality shows, doctor's appointments, 8 prescription drugs 3 times a day.
So the big problem with taking a lot of medications like that is basically polypharmacy. There's a lot of interactions that happen, and when you have interactions, you have side effects. So you're nauseous, you're fatigued, your muscles ache. All these sort of side effects are almost needed in order to battle off this cancer, or at least give you a longer time here on Earth. So it's tough, it's not an easy journey. I've witnessed it firsthand with my patients and obviously with my own mom, who unfortunately lost her life to cancer, but it's a difficult journey. If you ever had a loved one that you took care of or witnessed battle cancer, you know how hard it is.
Hey guys, hi, I'm Isaac. I have retinoblastoma. We had surgery on one eye when I was younger.
Retinoblastoma is a type of cancer of the retinal area of your eyes, which is like the light-absorbing portion of your eye, the posterior portion of the eye. It can be diagnosed with a proper light exam. When we shine the light on the eye, we actually see a red reflection of the blood vessels. But if there happens to be a tumor blocking that red reflection, you actually see a white reflection of the eye, and that is a serious, serious risk that needs to be further investigated for retinoblastoma.
I'm Augustus Waters. I'm 18 years old. And I had a touch of osteosarcoma about 1.5 years ago. So I lost this baby as a result. And now I'm part cyborg, which is awesome.
Prosthetics have come really far over the last 20 years. Not only are we starting to send feedback to the prosthetic from our brains in order to control them better, we're now working and experimenting on getting sensory feedback from the prosthetic back into our brains. And if that happens, that's going to be absolutely revolutionary.
Really? That is disgusting. Ugh, you were doing really well, too. God. There's always a hamartia, isn't there? And yours is, even though you had freaking cancer, you're willing to give money to a corporation for the chance to acquire even more cancer? Let me just tell you that not being able to breathe sucks.
It does, and a lot of people think that smoking increases rates of lung cancer. While that is true, you're not definitely gonna get lung cancer by smoking. What you will get is decreased lung function. What you have a mega high chance of getting is emphysema, COPD, true problems that are detrimental to life quality. Imagine losing the ability to take a full deep breath at age 40. Do not smoke.
I never lit one. It's a metaphor, see? You put the thing that does the killing right between your teeth, but you never give it the power to kill you. A metaphor.
That's what you got, buddy. That's your pickup line. How's that working out for you? A wet, loose cigarette in your mouth. Delicious.
The most important thing in any MRI is to lie completely still. But that day, it was almost impossible.
Yeah, it's really hard to lay still, and you need to lay still. It's also super loud, uncomfortable, claustrophobic in there. I've gotten a couple MRIs. It's brutal. And if you have to get multiple MRIs over and over again, they gotta find a better way.
And then this happened.
Oh no, is she febrile? Looks like a fever. She's very sweaty, night sweats. Common symptom, common side effect in cancer is night sweats. That's why if you ever go to the doctor and we have some symptoms that we don't quite understand, we ask about night sweats and unintended weight loss. All right, so we have a pulse of 112, oxygen saturation of 97 with a blood pressure of 127/80, which is acceptable.
Fluid in the lungs preventing oxygenation. They put a tube in. Drained like a liter and a half last night.
Chest tube from a pleural effusion. The space that surrounds your lungs can sometimes be filled with fluid, whether from a cancer or from an infectious process, and as a result, it makes it very hard for the lungs to expand, causes you to be hypoxic, and vital organs start suffering very quickly.
Normally, the tumors start resisting the treatment, and that hasn't happened here yet. On the other hand, the drug may be worsening the edema.
Truth is, very few people have been on phalanxa for as long as Hazel has. We really don't know the long-term effects.
What we're trying to do is prevent endothelial growth.
Endothelial growth is basically blood vessel growth. So the tumor starts expanding, creating new blood supplies, thereby feeding itself.
So I had a PET scan. And it lit up like a Christmas tree.
That's a scan essentially looking at metabolic activity in certain parts of the body. It will light up like that.
Are you in pain?
No. I'm okay.
Cancer-related pain is one of the worst types of pain. That's why some of the most powerful pain medications are used in cancer care. You think of why fentanyl was even developed. It was specifically targeted for cancer-related pain.
How's he doing?
He's had a tough night, Hazel. His blood pressure's low.
So in a situation like his, I don't know if he's struggling with sepsis that can cause a low blood pressure. Also cardiogenic shock if he's having congestive heart failure, but all of that can contribute to a low blood pressure, which obviously you can fix temporarily by giving fluids, blood transfusions, pressors, but at the end of the day, unless you treat the source, it's never gonna go away.
They're gonna stop the chemo.
Sometimes that's an important decision to be made when you see that treatment no longer has the benefit that you want it to have. It's actually impeding on quality of life. Therefore, it's not worth extending the quantity of your life, the amount of time you're around, if the quality of life is so poor and unacceptable to the patient. So it's a very important decision that needs to be made as a group, as a family, a lot of times with the help of a mental health specialist or even a hospital palliative care specialist.
One of the first things they ask you in the ER is to rate your pain on a scale from 1 to 10.
So originally the pain scale was created in order to make sense of a subjective feeling and to make it more objective. So we can qualify the pain, so we can see if a patient is improving, so that we can create a guidebook of what we expect patients to feel with certain conditions.
You don't get to choose if you get hurt in this world, but you do have a say in who hurts you. And I like my choices. Okay, Hazel Grace?
Okay.
It's such a Romeo and Juliet story.
Is it Romeo and Juliet?
They both die together.
Well, but they kill themselves.
But she's laying kind of about she's gonna die. She's giving in to the cancer to be with him.
I guess so. Maybe that's the ending. Maybe she dies right there.
Isn't that what is happening?
That was never my read on it.
Wait, is that the official end of the movie? Oh. Yeah, I think that's my read of it. That she was battling cancer and now she's like, all right.
Wow. Hot read.
That's funny. Get it? Because organ donor, but this is an Oregon donor. Is it Oregon or Oregon?
It's spelled Oregon.
See, it's Oregon, but is it Oregon or origami?
Origami.
And Oregon.
Oregon.
That didn't clear up anything. Doctor, I've been bitten by a wolf. Where? No, just a normal. Oh, that's good. That's a nasty bug you got there. Oh my God. We use bug for too many terms. A bacteria, bug. Virus, bug. Which virus? Who knows? A bunch of bugs. Parasite, bug. Got a tick bite, bug. Like pretty much if you go into a doctor and they write something about like a bug, they're like 50% chance likelihood that they're getting it right. Evolving from violent language. Instead of, I have a concussion, I'm in my bonked up state. What? I'm concussed, I'm all bonked up. My brain is bruised, I've got brain bonk. What a TM is a trademark? I'm in my concussive era. It's serving gonked gourd? What? My concussion may affect the quality of my work. Getting my concussy slonked. Person has an allergic reaction. Dr. Mike, after all, why not? Why shouldn't I talk about when I see someone on a plane? All right, I'll stop telling the story. But how often is it that you watch Grey's Anatomy and you see all these emergencies happen midair, and then it happens to you and you don't have the tools and you have to MacGyver it? I mean, come on, that's a cool story. Me after watching 5-minute craft video. Little medical bracelets, but they tell the nurse they're not allowed to do a TikTok about you. That's every patient because you have something known as HIPAA, Health Information Patient Privacy Portability Act. I have no idea. Health Insurance Portability Accountability Act. Oklahoma. Good Lahoma, bad Lahoma. I guess depending on which way you look at it. What happens in Oklahoma? If you live in Oklahoma, tell me what happens down there. Dr. Mike, eat a spoonful of sugar to stop hiccups. Me. No, you don't need that big of a spoon. Just a regular teaspoon. Decided I need to eat something healthy, so I made a delicious omelet this morning. I seasoned the eggs with sugar, oil, chocolate, and threw in a little flour for texture. That is not an omelet, that is a brownie. Do brownies have eggs in them? Slicing my strawberry shortcake ice cream bar like it's Wagyu beef. It actually does look like Wagyu beef. If anyone's ever had some of that Japanese Wagyu, A5 Wagyu, oof. But it's not super healthy because it has a high fat content. The good part about eating the strawberry shortcake ice cream like this is you will get full sooner because the more bites you take, the more you're tricking your mind into thinking you're full. This aged well. Okay, when they say this aged well online, that means some take was good that was made a long time ago, but why did this age well? Oh, it's a well that aged. Okay, well done. I bet there's a couple seconds on that medieval torture stretcher rack where it feels incredible. Oh no. No. What do we learn from the hippopotamuses? Is it hippopotamuses or hippopotami? Are you sure?
Yeah.
Is it bacteria or bacterium?
Bacterias.
Wrong. Bacteria is plural, Sam. And bacterium is a single bacteria.
Throw that to your mustache.
Yeah, I probably will. You can gain weight from eating any food with caloric value. And I threw in caloric value because I know someone's gonna be like, can you gain weight by eating paper? No, you can't gain weight by eating paper. But anything that has caloric value, if you overeat, you ultimately have a surplus of calories, your body's gonna store that. Certain nutrients are easier stored than others. Certain nutrients have more caloric value than others. Certain nutrients are harder to break down and access those caloric nutrients. So it's different, but it's all the same. Today I operate on a little girl. She needed O negative blood. We didn't have any, but her twin brother has O negative blood. I explained to him that it was a matter of life and death. He sat quietly for a moment, then said goodbye to his parents. I didn't think anything of it until after we took his blood and he asked, so when will I die? He thought he was giving his life for hers. Thankfully oh my. I was gonna pop out my lower lip and say, I feel bamboozled. Why do I feel like when I ask for emotional support, it's mostly him just asking for scratches? But somehow scratching him is like a level of emotional support. At least Bear likes me with my mustache. Music makes you caps lock shift, control, alt delete. What? Music makes you lose control! But music also makes you ASD. ZXC. Wow, you're looking kinda AZXC. Croc enthusiasts can now buy mini Crocs that attach to their regular size Crocs so they can wear more Crocs. I need to know the obsession of Crocs in healthcare. I understand that they're comfortable. I understand they're easy to slip on, they're easy to clean. They have holes. Fluids go in those holes. Sharps go in those holes. These are not medically appropriate shoes. Goose bumps. Do geese have, is it goose or geese?
Geese.
What about a male goose?
A goose.
Female goose?
Goose.
Sure.
Yeah.
What about a guise? Vintage ice cream scooper, very good condition. Was cleaning out garage, I found this antique ice cream scooper. This needs to be cleaned. That is not antique. Maybe you could say a little retro, but that is a speculum that goes inside the female genitalia to check out the vaginal canal and possibly the cervix. A teenager at work asked me if I was old enough to have seen a PlayStation 2 in real life. And if anyone needs me, I will quietly be walking into the sea. Oh my God. I collected money for PlayStation 2 inside a Pokemon tin can, which included quarters, $50, and singles that my grandpa gave me for doing little things around the house. And then we went and I paid with that change at KB Toys, which I believe is bankrupt now. I thought I was so cool because the only game I could afford was Tekken. I don't feel well. Okay, breathe in, Kirby. Sharon, send in my next patient. Back to the memes and my mustache in just a second, but first I want to thank Audible for sponsoring this video. September is my favorite time of year to try something new. Something about the end of summer vacation and the start of a new school year always inspires me to start a new chapter myself. That's why I started listening to Bad Advice by Dr. Paul Offit on Audible, which I'm loving not only because Dr. Paul Offit has been on the channel, but also he does a great job explaining why celebrities and activists aren't your best source for health information. You should seriously check it out. And Audible doesn't just have great titles like that, but they have podcasts or their exclusive words and music series from people like Snoop Dogg, John Legend, or even Tenacious D. New members can get a free trial too, so to get started, just visit audible.com/Dr. Mike. Remember, doctor is spelled out, or text Dr. Mike to 500-500. All right, let's get back to the memes and the mustache. Man shares picture before and after liver transplant. Why did the child become darker and yellow? Oh, did he take the child's liver? Oh, that's mean. Don't say that, come on now. By the way, jaundice is a thing that happens when you have a failing liver because it messes with your bile metabolism. Bacteria, viruses, parasites, cancer cells, immune system, a peanut. Yeah, for real. Sometimes our immune systems overreact to things that aren't dangerous, but also immune systems are wonderful, wonderful. Thank your immune system right now because you're surrounded by germs, by bugs, by cancer cells, and your immune system is taking care of all that without you even thinking about it. Women love telling you to wash your water bottle. It gets clean every time I fill it, babe. Not necessarily, new backwash into it. I can't begin to tell you the amount of disgusting bacteria that we all have in our mouths, that if you let sit in a used water bottle, how fast it grows. Oh, it's like a petri dish in there after a while. Nobody, nurses and lab techs. Every time I walk by one of my nurses or phlebotomists, they go, Mike, nice veins. I'm like, you ain't getting any blood out of these, Dracula. Dr. Mike watches 5-minute crafts health hacks. Dr. Mike's brain cells. Honestly, I should sue. Not because they put medical misinformation out there. Maybe someone else can sue them for that. I should sue them for the medical damage that they did to my neurologic system after watching those videos, which by the way, they don't link down below. I'm here, I'm queer, and my joint pain is moderate to severe. Yeah. Joint pain sucks. And you know what's really bad about joint pain? Is we have to oftentimes figure out what the cause is, and it's not always evident. Sometimes it could be something as simple as the way we sit unergonomically at work, or it could be something more severe like an autoimmune condition, as an example, rheumatoid arthritis. Macaroni and cheese beer, double cheese IPA. Hey, you know what's hilarious? I just went to see MKBHD, Marquez Brownlee, big tech YouTuber if you don't know, the biggest probably, play Ultimate Frisbee because he's a professional Frisbee player. I should say it's the American Ultimate Disc League. He won in the playoffs, which was really cool. I got to say hi to him. Here's a photo of us. But there was a dude drinking IPA in front of me and it was like citrus, melon, and peach mango. I'm like, how many fruits can you put in a beer before it's no longer a beer and it's a juice drink with alcohol? Come on, that's cheating. A wise doctor once wrote a prescription for penicillin because they were concerned about a penicillin allergy, but they knew 90% of patients who think they have penicillin allergy actually don't. Why is this funny? I can read this.
I thought you could. Thanks for translating.
Yeah, no problem, man. Save money by buying the lenses and not the frames. Honestly, the frame whole thing is ridiculous. And I don't know if this applies to eyeglasses. I know it applies to sunglasses. It's run by like 1 or 2 organizations that have a monopoly on worldwide frame distribution. And it's so shady. There's like really good videos on the topic. Morning, want to sleep. Afternoon, dying to sleep. Night, can't sleep. This happens so often. Not everybody. I can't put everyone in this category because some people do suffer with true insomnia for a myriad of reasons. But so many of us are at fault for our inability to fall asleep at night. A lot of it has to do with what's within our control. Not taking long naps during the day, not drinking caffeine close to bedtime. Stop taking pre-workout at 7 p.m. when you come home from work tired, you wanna go to the gym. It has a ton of caffeine. It's gonna be in your system. It's gonna make it hard to fall asleep. Then you get anxious, then you get angry, then it ruins your mental state. Then your blood pressure goes up. And that's how heart disease happens. How men shower. Deep scrub, water will get it. Yeah, you should definitely get your feet because that's where fungi live. Most people will, at some point, especially if you're athletes, will develop athlete's foot or maybe onychomycosis, which is a fungal nail infection. And those are hard to get rid of. You know, to treat one of those, topical things don't usually work well and they take 6 to 12 months to heal, even if you do use it. And then if it fails, it's like 50-50. Then you have to do oral treatment, and oral treatment, you not only have to do for 12 weeks, but in the middle, you have to get blood work done. Actually, before and the middle, get blood work done to make sure your liver is not inflamed because these medications long-term can inflame your liver. Clean your foots. You know how I got these scars? Oh my God, I've got myself with those. For those who don't know, those are icy pops. They're not great for you. Artificial colors galore, a lot of sugar added galore. If you have them every now and then, probably not the end of the world. But when you open them, you have to like tear it open and it creates these really fine, sharp edges that when you suck on the icy pop, it ends up cutting your mouth. Kind of wish I had one of those right now to cut this mustache off that Sam forced me to wear throughout this video. New version of Operation just has players use essential oils instead of performing a medical procedure. Honestly, instead of like body parts in there, you should just be able to deposit little crystals. Oh, you have appendicitis? Here's a little jade crystal. Oh, you like to be more fertile? Here's a jade egg courtesy of Goop. Real thing that happened, by the way. One bite of this chip would kill a 15th century peasant instantly. Why? Have we developed superpowers that they didn't have in the 15th century? And why a peasant only? What, would royalty be immune to Doritos Cooler Ranch? Every time I eat Doritos, and this is not factually accurate, I feel like I'm eating poison. But it tastes so good. And it probably isn't poison. It's just not an ideal food to eat often. Med school be like, identify the nerve. Oh my God. Here's a picture of what cadavers' bodies look like when we have to identify nerves. And you're gonna see how similar it is to this picture. It's really, really hard. I would go in and when you would learn the nerves, you'd be like, oh, these are really clean, I get it. But when they remove all the other landmarks and there's only one nerve pinned, it's really hard to identify where you are in the body. What can be smooth, but also rough? Endoplasmic reticulum? I knew it, I didn't even read it, I swear. Wait, why is this funny?
I think the first comment is someone trying to be sexual.
But the whole time I thought endoplasmic reticulum. What else can be smooth and rough? I know, a Brazilian jiu-jitsu fighter. They're smooth. They're also rough. Someone with eye drops puts eye drops, eyes drop. Okay, at least I followed along that one. Okay. By the way, we overuse Visine because Visine, what it does is it vasoconstricts the arteries in our eyes. And that's not always good because if your eyes are vasodilated, meaning the blood vessels within your eye, that might be for a reason. And just forcing them to close shut may not be ideal. In fact, I know Dr. Glockenplocken is not a huge fan of Visine. It's one of his greatest fears, or so he told me in our interview. Didn't you say you hate Visine so much and it's like your biggest fear?
It is. I might have said that. I do hate Visine more than anything else in the world.
Yeah, I had to save a gentleman's life on a transatlantic flight. A cat, a can, a cat scan. Touche. A cat in a cat scan. A cat can scan. A cat can scat a cat in a cat scan. Oh no.
On the shoulders? Well, now, anyway.
Are they playing golf in the rain? It also feels like fake rain, like from a sprinkler.
You're some piece of work, Billy. So I've been told.
When thunder roars, go indoors. But lightning strikes do happen. 24 deaths a year in the US about. Actually, 1/3 of them happen indoors. So the recommendation from the CDC to keep yourself safe from lightning strikes is to like not do the dishes, to stay away from plumbing, not to take showers, not to use electrical equipment because it can travel through the electricity in your home and through plumbing. So it's just about like sitting, being peaceful and meditating. And it goes without saying, being outdoors in a thunderstorm is not generally safe. Standing near tall objects is not generally safe, like trees. That's a really bad idea.
Someone call 911!
Okay, that's actually the first thing you should do after a lightning strike when it comes to first aid. Call for help. And then it's about trying to help the person in their time of need. Meaning if they're like vomiting, you want to turn them on their side. If they're pulseless, you know what you do. Chest compressions, chest compressions, chest compressions.
Thought we could move on to
Is she withdrawing from heroin?
so itchy.
Or maybe just acute intoxication with the substance?
I'm sorry,
He's wearing cross stripes on a shirt that has plaid on it? My man, pick one or the other. Whoa. Okay, this is some kind of psychosis-related excoriation where they start scratching themselves, thinking that there's insects on them or something.
I'm on the edge of my seat here.
Bro, she's stabbing herself with a fork. Can you show a little compassion?
Right, we were going to portfolio projections and first quarter profits, which we hope will double.
Liza, what are you doing? Liza, what are you doing? Liza!
These are officially the least caring colleagues I've ever seen in my life. She's scratching herself with a fork, having some sort of medical situation occur, and they're just annoyed.
To your knowledge, was Liza on any substances? No. She was 2 years sober. She knew better than that.
Just because someone says they're 2 years sober doesn't mean that that's the case. And also, as a police officer, if someone says no, move on. There's no point trying to push through in a situation like this. You test the blood and then you find out the answer.
Several victims suffering seizures, 2 people stabbed themselves. All symptoms came without warning. DPG special response is on its way. In the meantime, it rounded up everybody who's still standing.
I've never seen anything like this, Cap.
We need to get these people transported.
We're not going anywhere until you know what we're dealing with.
I mean, I would get everyone out of the building instantly because, first of all, you don't know if this is an inhalation situation or an oral ingestion, so something weird is happening here.
What'd you have for lunch?
Skipped it. Big breakfast. Wait for it.
I know who did this.
What?
Mercury.
Did this police officer / paramedic, I can't tell who this is speaking, know that this is mercury poisoning before he even opened up the sandwich? No, never gonna happen. And first of all, that type of mercury doesn't really get absorbed well in the digestive tract, only through respiratory, and then it can actually spread throughout the body, be neurotoxic and hurt the lungs, all that. The danger of that mercury is if it gets aerosolized, like with a vacuum or something or a fan. So the fact that they're all just like breathing it in and chilling, that's like not ideal.
I'm too scared. It's bad.
Oh, come on now, little man. Let me take a look at you. Just a toy.
Oh.
Okay.
Told you it's bad, huh?
We actually have tools for this in the ER to pull things out of noses. I just wouldn't do it on a roof. Because let's say you do it and it hurts the child and they move weird, they can fall off the roof. So get into a safe environment first, ideally an emergency room.
Okay, Harry. Showtime. Now, on the count of 3, I want you to blow your nose like you have the biggest booger in the world in there, okay? Okay.
I mean, for small things that could work, but for larger things like that, I wouldn't start doing it because you're drastically increasing intracranial pressure. So like, if you can just pull it out with tweezers, like in an emergency room setting, do that.
Okay, no worries. Just means we're gonna have to go to plan B where I use my special toy car removal device.
You promise it won't hurt though, right?
Yup.
Or you could just be honest with the child and not lie and say, it's gonna be very quick, move the subject along, say that it's gonna hurt less than leaving that thing in there. So you're creating an honest answer, but still keeping the child calm.
Okay, buddy.
Why standing? Why in the forest? If he starts having a major nosebleed, what are you gonna do in the field?
Got it!
This is like a bunch of dudes came together and said, we're gonna be doctors in the field, and they started practicing medicine.
How? After you left, I kept wondering how Harry got it so far up there. So you figured it out.
Tweezers. No. What the hell? Why is there lava in the pool? Was this house built on an erupting volcano?
Chad! Wait, stop!
Let's make tonight unforgettable.
Why is this turning into a rave? They're putting rave music on while someone's dying. Okay, so when you have burns that are this bad, you could actually start tearing skin off just by applying the slightest amount of pressure. In a situation like this, obviously the risk of doing that is worth it because you want to save their life. And one of the ways people lose their lives here is from a lack of hydration. When you have such severe burns, you actually release a huge amount of different electrolytes into your bloodstream, which can be toxic to certain cells of your body, especially your cardiac cells. So hydrating people that are going through a really bad burns is of utmost importance. It's like the first step. And then also knowing that when your skin is not intact, you actually lose a lot more fluids throughout the day.
Thank you guys for everything.
He's like Iron Man, but not.
God, is that the thing that's keeping you alive?
It was. It is now an antique.
We have to extract it. Here? Cap, that's impossible. We don't. It cooks his heart. But if we take it out, he'll bleed to death. Not if the heat from the rock cauterized everything around it. What if it didn't? We don't have a choice. Look. Damn thing's sinking into him. Clamp. Now.
The confidence level these first responders have to make medical decisions is impressive. You know, as someone who's worked in a hospital a decade, I have no idea what to do in that situation. I'd probably take it off, but...
What are you doing? No!
Oh, is this an MRI? Oh no. Just for people to know, there's a few types of imaging that we get in the hospital. Some are X-ray. CAT scans are basically X-rays with many slices. And then you have MRIs, which is magnetic resonance imaging, where we actually use spinning magnets in order to visualize the body in a way that doesn't create radiation. So there's no harm from the imaging. There may be indirect harms from finding out the results, but the actual process itself is not harmful to humans, with the exception of if they have some metallic parts on their body or they walk into a room with metallic items.
There should be a safety button in there that'll overheat the magnet and kill it.
The problem is we can't access the button. It's on the front of the machine.
Which I'm assuming is somewhere behind that gurney. Okay, tell your staff to step away, please.
What about the metal on our uniforms?
I was just getting to that. Help me! Help me! We're gonna get you down, but I need you to...
There are safety standards. It's called OSHA, Occupational Safety and Health Administration. I hope I said that right. Where you don't need to go in your friggin' lingerie to go and rescue someone.
His airways are clear, but I'm hearing a stridor. Possible pneumothorax.
What is the use in talking about his lungs like he's an inpatient in a hospital when he's acutely jammed? You guys can get dressed now.
Bilateral chest raise.
What does that mean? It means your lungs didn't collapse.
Why does it hurt so much?
Because you cracked some ribs.
Chest rise, first of all. And that means he doesn't have flail chest, which means that his ribs aren't broken. I would not go ahead and venture to say that his lungs aren't injured. I would like to hear bilateral breath sounds in all lung fields in order to say there's no pneumothorax.
When I left my ex, Julian, he said that he would ruin my life. And ever since our divorce, I've been feeling, I don't know, different.
Liza, are you all right?
Is she pregnant? Oh, she has some kind of very aggressive parasite.
I need you to hold still for me, okay? And you should close your eyes for this part. Little tug.
I don't know if this is ideal for people to do in the field, given the fact that some of these worms can actually attach to the intestines through like hooks and such, and then as a result, by ripping them out, you can actually cause trauma.
What is that? Roundworm? By the looks of it.
There's different types of roundworms. Almost all of them are treatable by medications called like albendazole or melbendazole. These are just anti-parasitic, anti-worming, deworming agents. Could be a hookworm, could be a pinworm. Hookworms are usually a little bit bigger and they can actually enter your body through skin. Going through feces-ridden soil in underdeveloped nations, it can actually end up in your intestines, as gross as that sounds. Sometimes the pinworms can lay eggs surrounding the anus and then like a young child can scratch that area and pass it on to others. That's why daycare centers oftentimes have outbreaks. And there's a test we do, it's called the Scotch tape test, where overnight we actually put a piece of Scotch tape on the anus and then take it off, bring it in, look at microscope, see if there's eggs on it.
Liza, are you okay? She must have aspirated some of the material. TK, tracker O2 levels.
So that can happen sometimes if you vomit from a laying down position. You can get some of the vomit into your lungs. And that can be quite problematic because in vomit, there's acid. Acid going into the lungs can create a pneumonitis. And over time, can even create a pneumonia.
She's setting at 90 cap.
If you're satting low, that means that you're not oxygenating your blood. She also looks like she's unconscious and not breathing. And if you should check her and she doesn't have a pulse, you should start chest compressions.
Nancy, start compressions.
Well, thank you.
Bastantísimo muerta la blanca. With your presence, you can...
Those are the worst chest compressions. She's pushing on her friggin' throat. This is a 911 show. They don't have a medical specialist on board to say stop pushing on their throat.
By your great power, heal this woman.
We've got her back.
Oh, well, I'm just gonna have that lady be with all my patients and saying nice things. Inhaler. By the way, for those who have asthma that's triggered by colds, it usually happens as a result of overreaction to the cold air, and sometimes even to the cold, dry air, and it causes a type of bronchoconstriction. There are some people that, especially before exercise, in what we call EIB, which is exercise-induced bronchospasm from cold weather like this, can actually get relief by using an asthma inhaler before the sport, and then they actually don't need it afterwards. There's a huge amount of worry in parents in children who have exercise-induced bronchospasm to the point where they're like, oh, I'm not gonna have my child play sports. It's the exact opposite. Playing sports is good for them. And a lot of athletes actually have some kind of exercise-induced asthma or just maybe regular asthma altogether, and they still perform very high caliber. Whoa. It's cold in that water. His heart rate's definitely slowing as a result of a dive reflex. That's so scary. Never let children play on ice. There is something to be said about drowning in really cold water where it actually slows the heart rate down through that dive reflex. And as a result, makes your body require less metabolic demand. Means that you can survive a little bit longer without brain injury. Rewarming protocol is really important here.
Does that mean he's dead? No, ma'am. You're not dead until you're warm and dead. We're gonna do some rapid rewarming, and hopefully we'll be able to get him back.
When we say rapid rewarming, we not only can put, obviously, heat packs around the body, etc., but we could also give warmed up fluids throughout the body as well through the IV. And those are the worst chest compressions I've ever seen in my life.
Get the portable ECMO machine. Copy that. Got it.
What is this?
You, ma'am. Yes. Please tell me your heater works.
Look, what is she What is this? She's literally going like this. I just broke my webcam.
Time, y'all, to find out who's got the sheer audacity to take on Terry's 96-ounce challenge, which is about 78 ounces more sirloin than any mortal should eat in one sit.
78 ounces of sirloin is a huge load of fats and sodium. That's where my main concern comes from. Because like if you eat a lot of protein, okay, whatever. But sodium, quite dangerous. Fat, could be problematic. It can start forming gallbladder issues, just nausea, vomiting. Oh, and that's a concussion.
Stay here for a minute. We're gonna get you out of here as soon as possible. Sonia, is there any chance that you're pregnant?
Pregnant with prime rib.
BP is 90/60.
But her heart rate's 116. I don't think it's a heart attack.
You don't judge whether or not someone's having a heart attack if they're hypotensive and tachycardic. Hypotensive meaning low blood pressure, tachycardic meaning high heart rate. In fact, when someone becomes hypotensive, that means that they don't have enough fluid or something's going on where they're losing blood. They're basically losing volume in their circulatory system, in their plumbing system. When you don't have enough pressure there, you can get the blood to certain areas of the body, like the brain and vital organs. Your heart can try and compensate for this by pumping faster, so it becomes tachycardic, it becomes a faster heart rate. That's cardiac output. So the fact that this person says, oh, she's not having a heart attack or she's having a fast heart rate is complete BS.
Can you tell me what year it is?
Tuesday. Concussion? Just doesn't make any sense.
Yeah, she hit her head. It makes total sense.
Her bladder's distended.
Perforated stomach? It's an eating contest.
Why are they diagnosing her? Stabilize and bring to the emergency room.
Is that her place there with the empty pitchers?
Oh, yeah, she was throwing them back.
This is hyponatremia. Water intoxication. We need to reposition her.
No. You do not look at empty glasses and say someone has water intoxication. You stabilize them so that they're not dying in the field. You bring them to the hospital and you allow people to do a blood test that will very quickly confirm or deny your supposed diagnosis here.
Grab me a catheter and a Foley bag. We need to divert fluids now.
Divert fluid from where?
Captain, can we get her on the rig and let the hospital handle this? We give her a catheter now, we can be liable.
Her bladder's about to burst. It's my call.
How does she know her bladder's about to burst? When someone becomes hyponatremic and their sodium level drops below 135, usually that happens as a result of medications or health conditions like kidney issues, but it could also happen through something process known as water psychosis, where people who are not in a well mental state chug a lot of water, and that essentially dilutes the amount of sodium that's in the bloodstream. Because when you have low sodium, that could mean you have excess fluid or actually low sodium, that you're getting rid of too much sodium. So in a person who consumes a lot of water, they end up diluting the sodium level. As a result, tissues start to swell. And the reason tissues swell is because the water starts leaving, in order to try and equalize, leaving the bloodstream and goes into cells. And when they swell, that can become problematic, especially in areas of the brain where there's limited space. Swelling can actually cause brain death.
Mateo, unplug the battery. Judd, Marjan, make sure there isn't any fluid leaking. It's gonna ignite.
Face shield stuck, Cap. No, leave it alone. Don't force it. Let's just see what we're dealing with first. TK, put him on the life pack.
Copy, Cap.
Hey, sir, we are here to help. Can you tell me your name?
Looks like he has a subconjunctival hemorrhage.
BP spiking, Cap.
We're looking at possible orbital compartment syndrome.
No, you're not! Stop making up things! I'll give 15 right now different diagnoses that are more likely than what she just said. This person is on drugs because they're wearing a night costume out in the middle of the day. They have a concussion because they just got hit by a car. They have a brain bleed, which could be a subdural or epidural hematoma. They could actually have an aneurysm that's ruptured. They could just have cranial hemorrhage. They could also be having cardiac arrest because of chest trauma. Like, the amount of things that could be going on before she makes this ridiculous diagnosis is insane.
BP's coming back down to earth, Cap.
Cap, look at his lips. And I do not like this rash. It's erythema.
Like, that could be a raccoon sign because he fractured his basilar skull plate.
This isn't a regular head wound. This is carbon monoxide poisoning.
Which explains the delirium.
How did she get to carbon monoxide poisoning?
Well, this could be something. About 5 blocks from you, there's a novelty pizza place, swords and slices.
Come on, man. Carbon monoxide poisoning is very real. If people die every year in the United States because of carbon monoxide poisoning, it's usually the result of a terrible accident. Going into a well-ventilated space solves that issue. And the reason carbon monoxide poisoning even happens is because the carbon monoxide actually displaces the oxygen on the hemoglobin, which is the oxygen-carrying portion of the red blood cell that now can't carry oxygen. And as a result, you start having really bad health effects.
It's a medieval mass casualty.
Yeah, it's a good thing they weren't open yet.
And what, they don't have a CO2 detector?
Judd, why don't you find the control and shut it down?
Why don't you get the people outside and that will help all of them?
We're gonna need more O2 off the truck.
No good.
Yeah,
Just used the last cylinder O2 about 5 minutes ago.
Oh, so how about bringing them to a medical center instead of treating them right there on the street?
We should eat here sometime. Place seems dope.
Okay. I was like, I really have to figure myself out.
The reason that I really decided to do this is my friend Joe over here, my really good buddy, texted me and goes, can I say something with love, honor? And then he doesn't even send me anything. He just sends me a picture of me on FaceTime. And then I go, I know, I'm too fat.
Everyone has a different motivation for what drives them to want to make changes in their body. Some, it's appearance, others, it's their health. To me, the reason why I recommend it to many of my patients is because of their health. Ideally, I'm trying to optimize them to have the greatest chance of success. And when people say, well, you can carry more weight and still be healthy, that is true. Totally, it can happen. But the idea of carrying excess weight, why it's a problem, is down the line. It creates excess health risk moving forward in the future. So I don't just think about, are you healthy now and are overweight? It's, are you healthy now and will continue to be healthy, or are you facing increased risk?
This is my before body. Or if you're watching this video in 4 years, it may be my current body after a relapse.
Oh my God! It's worse than I thought.
What do you mean worse than I thought? That's basically what I look like right now.
I feel really uncomfortable standing like this in front of you guys.
Please put your shirt back on. I was up close like a viewer would be, and it's pretty fucking bad.
This is a lot of body shaming happening right here, and I'm not entirely a fan of this. He's probably not carrying that much excess weight where it's gonna be health-wise problematic. If he says, I prefer to look a different way and I wanna get healthier and I wanna look more muscular, that's one thing, but like making fun of his appearance, it might not be bad for him, but it can be triggering for others, and when you're making content for millions of people, you gotta factor that in. I know people come after me for being fat phobic when I talk about weight loss in general, but I think when a doctor is talking about carrying excess weight and that excess health risk that comes with it, that's different than when someone is just poking fun at their appearance. So a DEXA scan is a body composition scan. The way we use DEXA scans in medicine is more so for bone density testing to make the diagnosis of osteoporosis or osteopenia. But what's cool about a DEXA scan is that it's also become the gold standard for body composition, which tells us how much muscle tissue, lean muscle mass, as well as body fat is present. And through there, we can do a little bit of a calculation, decide what someone's body fat percentage is. There are actually some error rates with it. And I know people say it's the gold standard, and that's true. Hydration status, sex, disease state, the type of machine you're using, the current software update that it has, all play a role in its accuracy and whether or not it changes from scan to scan. So it's important to keep that in mind and not just rely on that as the sole indicator for your health.
Your percentage of body fat on the DEXA scan is going to be 27.8% body fat.
Ooh, is that good?
No, my brother. That's obese.
No, it's not. Is it actually?
I believe the WHO does 25% for males.
I don't have a numerical goal where I'm like, I want 9% body fat or I want to weigh 160 pounds.
I don't think that, like, unless you're training for a very specific goal. Like, for example, if you're a marathon runner and you're doing it professionally and you need to chase a certain time, that makes sense. If you enjoy the passion of chasing something specific, you can do it. But health-wise, I don't ever push someone to get to a specific body fat percentage because we don't yet have good correlations as to what number is actually perfect for you. It's more of a single number that we look at in combination with all the other numbers and aspects that are going on in your life and health in order to decide whether or not you're optimized.
Mine is all visual. Like if I'm okay to look in the mirror at myself.
That's fairly normal and should not be judged. So if he's going straight from being sedentary, going and starting to do miles right away may not be ideal unless he's comfortable with that kind of mileage. If you start too quickly, you can develop soreness, you can develop injuries, so much so that it demotivates you to continue working out. And it's all about being continuous. And remember, exercise is not the end all be all for weight loss. It's more about the diet. All the way through. That's pretty good. For someone just off the couch?
A lot of the people that do these transformations like kind of give up the fun part of their life. You know, eating good, fun things from time to time, and like that's what I don't want to do. I want to make sure like whatever I become or however good shape I get to, like I want to make sure I can maintain it.
Yeah, that's the problem. When people think about transformations, they think about it as a point in time as opposed to making a lasting, healthy lifestyle change. So it's good that he has that in the back of his mind.
Oh my Lord. That's the biggest I've ever been in my entire life.
I've never seen people who normally weigh themselves with their shoes on.
So in order for him to retain muscle and lose only body fat, we're gonna be aiming for about 200 grams of protein a day.
200 grams of protein, he's 180. It's a little bit over a gram per pound. It's fine. There's been some arguments about getting 1 per kilogram of body weight, 1 per pound of body weight. Some people do more. Ideally, you should be keeping your protein intake pretty high if you're trying to minimize muscle loss when you are losing weight. And you still will lose muscle when you're losing weight, no matter how much protein you take in. It's just part of the journey. That's why people who are doing this professionally have periods where they're bulking, where they're shredding. It's not just year round, they're fully ripped all the time perfectly, because that's not sustainable. This type of high-intensity interval training has been shown to be really beneficial, specifically for fat loss, because it helps grow muscle, but it's not this long-standing cardio workout where you are also losing muscle. So the idea is mixing up workouts where you're doing strength training, high-intensity interval training, or moderate continuous training where you're basically walking 3-speed, 12 incline for 45 minutes. That sort of mix is usually the best outcome for someone who's just generally trying to get into good shape.
Like, well, who's your dream body?
Oh, my dream body? Tom Holland.
When he's ripped.
When he's ripped.
The problem when people look at celebrities, and I've done this myself, I went to the gym and hold a picture of Chris Evans or something and be like, that's gonna be me like he was in Captain America. Because a lot of times it's not realistic. They get paid to look like that. So their lives are surrounded by dieting, exercising, with professionals. Sometimes anabolics are involved, or they'll say that they need testosterone replacement, what have you. So don't think that those are realistic bodies that they're walking around year-round with. It's just not true in the majority of cases unless they have amazing genetics or something.
And run. The number is, you went from 27.8 to 25.2. Wow. You went from 46 pounds of fat to 41 pounds of fat, and
wow,
you gained 4 pounds of muscle.
This is the thing when you start an exercise program. The scale might not change as quickly. Initially it might, because you might lose some water weight, but then it plateaus because then you start gaining muscle, but losing fat. So you're creating a different composition of your body, but the numbers on the scale don't change. And sometimes that demotivates people. So it's important to look in the mirror and make sure that you're seeing the change as well as knowing your performance in the gym is improving.
I ordered 30 strip bucket for the ride, airplane ride, because we have 2 layovers.
How many calories do you think are in there?
In a 30 strip bucket, 12,000.
His whole mantra is that he wants to get fit eating whatever he wants. Maybe it'll work, maybe it won't.
It's not about maybe it will, maybe it won't. It's about making sure the calories are correct. People like to dunk on calories in, calories out, and show every example in which it doesn't apply. But the reality is, it still applies. If someone has a condition that impacts how much they're burning, like if someone can't exercise, that's still impacting calories out. If someone has a condition where they have hyperphagia syndrome, where they're overeating food, that's still excess calories in. But if you control the amount of calories in and you control the amount of calories out, you will see results.
Obviously, I could see some changes with my shirt off. Like, in good lighting, I could take a solid picture. But like, with my shirt on, I mean, look at me. Nothing's changed.
Health has changed. That's the benefit. It's so wild, because if I came up to someone, I was like, hey, you want to live longer? Everyone will say yes. And then I'll say, okay, exercise. And they'll go, but will I look better? You're gonna live longer.
He's losing progress because of his diet.
How many French fries am I allowed to eat?
None, bro, put it down. David, deadass.
The fact that he's eating the French fries and drinking the Coca-Cola is not inherently a problem. The issue when you're consuming ththese refined carbs, quick digesting carbs, sugars, is that they're easy to overconsume. They make you hungrier quicker, so they don't keep you satiated. So as a result, they're easy to overeat. And when you're overeating and you're constantly hungry and you're getting these swings and crashes, it makes your diet usually unhealthier.
He's trying to prove to me that his method works.
It feels so good.
And this is not great, obviously, for cholesterol, high saturated fat, not healthy fat either, so.
My goal going into this DEXA scan is anything around 16.6.
15.7.
Wow.
Good work.
Yes. This is great news, being that you traveled for 2 months, but like, you can't do what you did last month.
Dude, it'll go down again, I promise you. Okay, so the next goal would be, well, I'm traveling again. And this one's gonna be the worst one, because I'm gonna get sloshed this next week.
Something people don't consider is, yes, when you consume alcohol, it has calories. So it's easy to drink more calories, especially with sugary alcoholic beverages. But when you are inebriated, you are drunk, you tend to overconsume food in general and lose sense of how much food you're consuming. So it's easy to drink, pick up 1,000 calories just from the drinks, and then afterwards to say, oh, I'm so hungry, and just massively binge another 1,000, 2,000 calories. And if you do that often enough, that's not gonna be healthy for your body.
Today's scan, you're at 16.4. And the previous scan last month, 30 days ago, you were at 15.7. You gained a pound of body fat and you lost basically 2 pounds of muscle.
You know, they're doing so many of these DEXA scans. Normally, you wouldn't be super concerned about the amount of radiation exposure because it's basically the amount that you would get getting an x-ray. But if someone's getting an x-ray like every month, I would be like, do you really need that? Because those things add up. And while traveling and being on an airplane does expose you to radiation as well, it's like, you want to limit that, especially if it's not for medical reasons. Like if you're getting an x-ray to check for a fracture because you might need to intervene, that makes sense. But here, it's purely for entertainment, so I don't know.
He's been drinking whatever he wants, he's been eating whatever he wants, and you can only get so far with that type of mindset. I told you multiple times that if you're not like tracking what you're doing, you'll reach a point of diminishing returns, which is exactly what's happened. And your way is my way or the highway, and this is where it's gotten you.
Tracking isn't absolutely necessary. Tracking is valuable to get an idea and a sense of what's in typical foods. Because it's easy to underestimate, let's say, sugar content of some foods or overestimate protein content of what you would call a healthy food. So I like tracking to get a sense of things, or if you just need help because your life is so busy, tracking is valuable, but it's not for everyone.
We stopped seeing results for about 2 months. And in order to get him back to structure and discipline, we created the 75-day David Dobrik challenge. The plan consists of these 4 key elements. Number 1, diet. So far, David's been eating meals that are high in calories but low in protein. McDonald's, Taco Bell, Subway.
These are just like the unhealthiest foods. And again, I'm not saying like you can't have one of these meals every now and then. It's just like consuming them every day like that is just, forget about the weight. Metabolically, it's unhealthy.
We're gonna replace those meals with healthier alternatives that have the same calories but much higher protein.
These 4 meals is what you can have, plus this, plus a shake.
Every day?
Every day.
Number 2, calorie tracking. The ultimate goal is to consume fewer calories than what you burn. To achieve this, David will have to be tracking his meals. Number 3, workouts. David's gonna be working out every day, specifically 30 minutes of steady state cardio on a treadmill.
It's funny that we just talked about this. You also don't need to work out every day. You definitely want to include a rest day. If they're saying just going for a mild walk as exercise, that's fine, but you need to incorporate some rest days in there.
And finally, number 4, no soda.
What?
No soda at all. No diet soda, no regular soda.
I can't have a Diet Coke.
You can't have any type of Coke.
I have like 5 Diet Cokes a day.
I wonder why they're telling him to cut out Diet Coke specifically.
The goal of this challenge is to build consistency and self-control. So if he does that every single day for 75 days straight, he should be able to build enough habits to be able to last a lifetime.
That's not necessarily true, and that's not my opinion. That's not just what I see in my practice. That's just not what the evidence shows.
Big day, baby. Final DEXA scan today. I'm done. Tomorrow, eating all the fast foods. Wingstop. No. Okay.
So much for if he stays for 75 days, he's gonna build up great habits.
Regardless of the number for this final DEXA, he crushed the 75-day challenge.
Exactly, that's why the DEXA thing doesn't matter. It doesn't matter. Treat the patient, not the lab value. If you're a person, think about how you feel. If you're a doctor, think about treating the patient.
Your first scan, you're at 27.8% body fat. Wow. Now,
I am at a whopping
11 months later.
Oh my God! Why would you say it like that?
You are down to 13.1%.
Wow! That's half. But again, that information is strictly only for the wow moment, like nothing else. And you know what else could have created that wow moment? A photo of before and after, without all the radiation.
You went from 46.4 pounds of fat to 20.5 pounds of fat.
See you later, fat.
Losing a total of 25.9 pounds of fat.
Wow.
Is he gonna start YouTube boxing now? Who do we want to see every
single day?
Wow, 30 cans. What is it, 12 ounces per can? 30 times 12 is 360 ounces. So 2 liters, 64 ounces. That's basically 5 of those. She drinks 5 2 liters a day. Holy moly. First problem right off the bat. Tremendous amount of added sugars in each one of these cans. If I was to show you before I pop up the image here, how much actual sugar is added to each one of these cans, it will blow your mind. Take a look.
The most I had probably in a day is 50 cans. I'm always drinking cola.
Also, not good for your teeth and not good for a lot of body parts. Also, what else is in cola? Caffeine. That's a ton of caffeine, especially if you're taking it at night. There's no way you're getting restful sleep on that much caffeine.
I do get tired a lot. I don't have that much energy.
Because you're not sleeping well. We said that right off the bat. You're having too much caffeine, too close to bedtime. And then on top of it, every time you drink basically, every time you drink a cola, your sugar spikes, your insulin spikes, you get a little crash.
Recently, Amy had a serious health scare when she discovered a lump in her chest, which her doctor suggested might be due to excess caffeine.
I think that you drink too much caffeine, and that is why you have the tumor.
Hold up. None of that makes sense to me. I think specifically with caffeine, we've seen studies that show both a protective effect on breast cancer. Small, rare studies show that there's no change in breast density for premenopausal women like herself. So like, I don't buy that tumor or mass was caused by caffeine itself. I've just never heard of a case like that. Could it have contributed due to an unhealthy lifestyle? Yes. But due to? No. Wow, that's a lot of cola. That's a lot of sugar.
Wow.
950 pounds of sugar is what you get in your cola each year.
I don't think that's understandable to the human mind, but they love it for the dramatic effect so they could stand in the backyard and be like, whoa.
What we see right here is you're already a pre-diabetic.
Okay, if this is a fasting blood sugar, the glucose range puts her in the pre-diabetic range at being at 115. Also, I'm very, very surprised that her triglycerides are so low. Triglycerides is what you would expect to be high in a person who has uncontrolled or poorly controlled sugar or a high intake of sugar, because the body stores sugar through triglycerides in the blood. But the pre-diabetic thing should scare her, because while pre-diabetes doesn't mean diabetes, it is curable at that stage. Once you become a diabetic, you're diabetic for life. Your risk factors change.
24-year-old Michael lives on meat. He averages up to 150 pounds monthly. That's equivalent to an astounding 1,800 pounds a year.
The real problem with overeating meat is your overexposure to saturated fats. If you're eating a hot dog, you're also consuming a lot of carbs. Not only are you overeating carbohydrates that have been bleached, therefore rapidly converted to glucose and then rapidly stored as fat if you don't eat it, you're also consuming saturated fat. So all of that ends up raising your bad cholesterol numbers, your triglycerides, puts you at increased risk for heart disease, stroke, anything with cardiovascular conditions.
In one day, Michael can put away as much as 5 quarter-pound hot dogs, a rack of ribs, 2 steaks, and up to 30 chicken wings.
Red meat is a maybe carcinogen. Like, it's still not all the way there. It's like suspected, but the ones that are suspected are the processed meats, like the hot dogs, like the chicken wings. So you want to avoid those and eat those, like almost get rid of them totally, but occasionally if you're going to a football game and you have a wing, to me, I think that's a reasonable balance.
I'm a licensed psychotherapist specializing in eating disorders and addictive behaviors.
JJ Virgin. I'm a certified nutrition specialist and a certified health and fitness specialist. This is a ridiculous amount of chicken wings.
I don't like the confrontational nature right away. You can't come in to a healthcare encounter with that kind of attitude and hope for good outcomes. You're setting up the encounter for failure right from the start when you come in judgmental like that.
So this would be dinner.
2.5 pounds of meat right here.
2.5 pounds of meat is a lot of meat. When we're talking about a portion of meat, it should be around 6 ounces, really, like a fist amount.
That is 1 month worth of your meat consumption.
Where is this? Where is this being filmed that they just jammed all of this meat in there? Outside of being a cool visual for TV, I don't know how this helps change his mind. Like, if I'm him, I see it and go, okay, and?
It looks good.
You think this looks good?
Yeah, that's what I was gonna say. Like, how do they think this would turn him off?
We see this AA-EPA ratio, which tells you the risk of heart disease.
What is this that they're looking at? This is an anti-gliadin immunology blood test that tells you whether or not you have antibodies to gluten. What does this tell him about his meat consumption? These are not the lab tests that I would show. The test I would show him is his LDL, his triglycerides are gonna be quite high. Having really elevated triglycerides puts you at a risk for pancreatitis, which could be a life-threatening condition requiring an ICU stay.
You're 24 with high risk of heart disease.
Yeah. What she was saying and what they were showing all make no sense. Her actual statement is fine. He is at higher risk, but not for the reasons that they just showed.
Victor lives on cheeseburgers and cheeseburgers alone.
Oh no.
Love burgers.
He eats 4 burgers a day, 28 each week, which is nearly 1,500 burgers every single year.
It's meant to be fast food, to be on the go every now and then, not to be something that is your primary meal. And if you develop type 2 diabetes because of the diet that you're following, one that is high in fat, high in sugar, what ends up happening is you have a high risk of stroke and heart attack, yes, but also high risk of developing problems in your eyes leading to blindness, peripheral neuropathy where you feel pins and needles or even lose sensation in your fingers and toes, and that becomes such a problem that you might have a rock in your shoe that you don't even feel, and then it leads to a terrible infection that leads to an amputation. Like, think about the cascade of events that was to happen just from overeating burgers your whole life. Again with the cool visuals. I could see them in the producer's room. Let's get cartons of burgers and shove them in the trunk and open them! Ah!
29-year-old Eric of Cincinnati, Ohio, is addicted to French fries.
I eat basically just French fries.
You can't grow up to be a functioning adult just eating potatoes and French fries. Like, you need vitamin D. Rickets is a legitimate concern for people who don't eat or consume enough vitamin D. Calcium.
I'm very active. I skateboard once a week, if not twice.
Because of his athletic lifestyle, Eric hasn't become overweight and doesn't think French fries are damaging his health.
The way you look and the way that your body's functioning is not the same thing. My cholesterol video that I made talking about my blood test results, I was losing weight because I wasn't eating a lot of calories, but the quality of the foods that I was consuming was leading for my cholesterol to creep up, go real high, and therefore put me at a higher risk for having a stroke or heart attack. I may have looked great, my abs may have been coming in, but that didn't mean I was healthy. Weight is an important factor of someone's health, but it's not the sole determinant of someone's health status.
Eric needs a dose of shock therapy to really come.
Oh yeah, that's what he needs. Shock therapy.
French fries, starch, salt, fat. This is the worst type of fat that you can possibly eat. It's trans fat.
Yeah, trans fat is a big problem, and in some countries and parts of actually the United States have outlawed or reduced the amount of trans fats that can be in foods. Initially, trans fat was added to our foods in the 90s, but then we realized that it truly does spike your LDL, your bad cholesterol, and lower your HDL, your good cholesterol. So it's like a doubly negative effect on your health. And we saw rates of heart disease just absolutely skyrocket. Now, that being said, very important point here, just because something says no trans fat on it doesn't mean it's a healthy meal.
We wanted to show him the amount of French.
We need to show the fries! Get the boxes of the fries! Forklift! Truck!
This is LDL cholesterol. It's the worst kind. And that's what this elevated number is right here.
LDL, being 110, is slightly elevated for him. So it's not even that high. But a 110 is not nearly something that is scary. Very surprised. These blood work results are very suspicious to me. That he doesn't just eat French fries, or he's a very unique anomaly.
Daniel has been obsessed with raw meat for the past 6 years. He feeds his habit 4 times a week in pound after pound of raw beef, eating whole steaks pulled right from the packaging.
If you look at cultures like the Inuit, they were quite healthy and they ate primarily raw meats. They didn't even eat that many vegetables because they didn't have it. They lived in the Arctic, in the tundra. But what they did eat was the entire animal. So they got fiber from the parts of the animals that we no longer eat. So there's a lot of problems when people try and look at what other cultures do without fully understanding exactly what they do and how they do it.
Even raw chicken.
Can somebody say salmonella?
I have never gotten sick from eating raw meat, ever. And I've been doing it for 6 years now.
It just takes one time to get really sick, to get ICU hospitalized, to potentially get a colitis so bad that you need a colon resection and then need to wear a colostomy bag, to realize that, wow, I probably shouldn't have been doing that. I, as a doctor, can't tell this person what to do, nor should I tell this person what to do, nor should I judge what this person is doing. But what I could do is tell them the risks of what I just said, and then see if, like, are those risks acceptable to you? And if so, why? And if the person is cognizant and they can understand and accept those risks, that's it.
You do have a parasite.
So this looks like they gave him an ova and parasite test of his stool sample, and they saw that there's a parasite, but they didn't do a taxonomy, so they don't know what kind of parasite it is. And it very clearly states there that there's no treatment that's even necessary if the patient doesn't have symptoms or other inflammatory markers. That's an important note there. Something else I want to point out is if you eat undercooked meats quite often, you put yourself at a risk of developing a tapeworm. Undercooked pork can lead to a cyst-forming parasite that can actually lay cysts in your brain. You're risking all these things for no real benefit. Like, just cook your meat somewhat.
One more thing that's of interest on this test, rotting protein that hasn't digested sitting in your gut.
They need to stop ordering these tests that mean absolutely nothing. Like, this show is so ridiculous.
Short-Stammhouse syndrome.
Never even heard of it.
It's a muscle condition
Wow.
where your muscles get really, really tight. That's how I become stiff, because they're always working.
This type of abnormal tone of muscles, I've seen in the elderly with dystonia and maybe even Parkinsonism, but I've never seen it in a young person.
Owen's dad, Will, noticed that his son wasn't moving like other children. Owen visited 8 doctors in 8 months.
This is why at every pediatric visit that's a physical, we do developmental milestones and we see how a child's developing, because in many instances we can do some early intervention, whether that's adding a hormone, physical therapy, behavioral modifications, to help children reach their maximal potential.
He has persistent muscular contraction. And you look at somebody who, like Owen, who looked like a little pocket Hercules. He's got unbelievable muscle definition, and that's really because he's got isotonic contractions all the time.
That's incredible that he has this contraction. Imagine how you feel when you get a cramp, and imagine that going through your whole body. That's the difficulty this boy's dealing with.
In the small town of Scheidelberg, Austria, lives a teenager with a very rare genetic condition. Raphael's skin grows extremely quickly and turns into confetti-like flakes.
Oh, is this acanthosis?
My condition is called ichthyosis, or the fish scale disease, and I've had it since birth.
It's really unfortunate that in the medical community, maybe to be relatable, especially when it comes to pathology, we name things after foods or animals, and it can be quite problematic for patients because they have to say they have fish skin disease or like acanthosis with confetti. Like, that's not ideal for someone to say.
Ichthyosis with confetti has been recorded fewer than 20 times worldwide. It causes abnormal quantities of keratin in the outer layer of the skin.
Skin, the way that it heals, the way that it functions, is on the epidermis, which is the superficial layer of skin. You constantly have shedding of skin and new skin cells come up. And that is the way that the skin normally functions. That's why if you really test dust inside a home, a lot of it is made up of human skin. And while you can't see it happening, it's happening all the time.
In 2008, Raphael's mother discovered an unusual solution to treating her son's condition.
Oh, interesting.
To remove Raphael's excess skin, at 6:30 every morning, he's lowered into a specially made tank containing 300 skin-eating fish.
Wow. I've seen pedicures like this where they have the fish chew the dead skin. This also doesn't hurt because these are sloughed off dead skin cells, so it's not causing him any discomfort, at least I don't think.
It was worse before. I couldn't move as much, and it was harder to clean up the scales. This is much better for me.
And he's feeding the fish. It's like a win-win, a true symbiotic relationship.
Oh. Thomas and Vincent's headgear might look like it's out of a science fiction movie, but it's been developed by a team of doctors and designed to shield them from certain death.
When Thomas and Vincent were nearing their second birthday,
Reddish marks appeared on their cheekbones.
Reddish marks on a young child like that don't necessarily point a clear picture of what's going on. It needs to be placed within a whole host of different differentials, like possible diagnoses, and only through a very thorough history, a thorough physical, doing some lab work, can you start narrowing down exactly what's going on.
We developed small cancers. For example, I had one here on my lip. We had others on our arms and face, which we had to get rid of.
The twins were diagnosed with xeroderma pigmentosum, known as XP, giving their skin a potentially fatal hypersensitivity to ultraviolet light.
For XP, individuals will have their cancer risk go up 10,000 times than that of a normal person or an average person. So if you're not shielding yourself from UV rays, your risk of cancer is almost certain.
We both have a scientific education, and quickly we concluded that the only possible solution at the time was to protect them from ultraviolet rays.
And hopefully supplementation with vitamin D, given the fact that you need sunlight to convert vitamin D into its active form via your kidneys. So yeah, vitamin D supplementation is going to be important for them.
Augustinopolis in northern Brazil is the home to a little girl with a condition so rare, there have only been 50 cases reported since the Middle Ages.
Wow, that's very rare.
Congenital hypertrichosis, or werewolf syndrome.
Again, with the terrible naming of conditions, like stop calling it werewolf syndrome. First of all, there's no such thing as a werewolf. No one is proud to carry that label and that stigma associated with it. Let it go.
2-year-old Camille de Souza is living with the same affliction today.
Well, first of all, with hypertrichosis, where you have excess hair growth, it can happen in many different ways. Like even hirsutism, which can come with PCOS, can have hair growing in unusual places for a female that you normally see on a male. But then there's other cases where you see it growing everywhere, and that's terminal hair, so it's gonna be darker, thicker, as opposed to like that peach fuzz that can sometimes never fall off a human from when they're born as a child, which is normally it's supposed to fall off.
There is no medication that can make the hair fall out. Laser treatment is the only option.
Doctors begin with a test run of the laser to see how her skin will react.
Also, given that her skin shade is a little bit darker, there could be risks with hypopigmentation, burns.
Successful removal of all her hair will mean hundreds of treatments.
In a lot of situations like that, the laser, what it's doing is it's heating up the hair follicle and actually destroying it. And the more you destroy it, the more likely, more times you destroy it, meaning the more treatments you go in for, the more likely you are either to cause scar tissue or permanent damage so that you're not growing hair in that area.
5 weeks later, and Camille is vastly improved and already more accepted.
Yeah, you see those burns? I would think that with technology, it's unfortunate to say, but I think with the technology we have here in the US and the experience we have here in the US, I think maybe it could have been done in ways where it wouldn't cause that type of skin damage. But then again, it's hard to say.
Weighing in at just over 46 pounds, he is nearly 3 times the weight of an average baby boy.
Yeah, something's going on here from a metabolism standpoint. When a child is this size, it's rarely due to just traditional overfeeding. This is some kind of hyperphagic syndrome where the child's eating too much due to something in the metabolism.
We started to notice he was overweight when he was 3 months old. But from that moment on, his weight just kept rising.
Generally speaking, in the medical community, we like babies to carry a little bit of excess fat. It's good for development. It's ideal early on. We've seen that it fosters good neurologic development. But then when it crosses a line and it starts going past the growth curve of the 99th percentile, now you're putting the child at risk for developmental issues from not just the musculoskeletal side of things, but also the cardiovascular, neuromuscular. Imagine what strain on his heart just to move because he's carrying this much extra weight for his age.
Santiago was already suffering from life-threatening obesity-related diseases, including diabetes and hypertension.
Everybody is expecting that it's the parents treating him very bad, and that's the reason why he's so obese, but it's not actually possible to feed them into that degree of obesity.
That's why I said it's not an overfeeding type situation.
Santiago is suffering from a condition called congenital leptin deficiency.
This is a hormone that's very important for controlling appetite. And actually, children who suffer from this will not just overeat and have this hyperphagic state, but as they get older, they will eat in secret. They will steal from others' food. They will get into fights over food.
A daily injection of the hormone leptin will stop Santiago's constant hunger, and eventually his weight should be normalized.
Isn't it incredible how much of a role and impact hormones have in our body? And that's one hormone. There are so many hormones that are playing these vital homeostasis controlling factors in our body. And like a hormone to protect us from overeating, a hormone to protect us from undereating, a hormone to make sure we're not overhydrated, one protect us that we're not underhydrated. There's so many sensors within our body. It's truly incredible that we actually continue to function each day.
Twingy was born with an extremely rare condition known as severe genou recurvatum.
Wow, I didn't even understand exactly when I was first looking what was going on, but this condition is basically known as knee hyperextension. So when you lock out your knee, it's really not supposed to go past 10 degrees. And if it does, for whatever reason, whether you have a congenital deformity, muscle weakness, something going on with the bone, that's considered this condition.
Her knees bend the wrong way, so she walks on the backs of her lower legs.
This is obviously not due to a connective tissue disorder like Ehlers-Danlos, but I see a lot of patients who have laxity in their ligaments can hyperextend, and sometimes over time from standing on hyper-lax ligaments can actually develop a condition like this. Maybe not to this degree though.
Despite her disability, Twingy learned to walk and got around as best she could, attending school where she was accepted by other students.
That's amazing because social acceptance is of utmost importance during childhood and adolescent development. I do see a lot of and foresee a lot of problems for her from an infection standpoint unless she gets adequate padding for her knees where you can constantly have skin breaks. And I imagine calluses would form, but even with calluses, you're gonna have issues with infection.
Twingy was content with her life until 2 years ago, when a charity offered to fund surgery.
We also don't know why, but this condition is more prevalent in women.
She underwent a series of scans to help surgeons determine what could be done.
That's of utmost importance because you need to figure out how are you going to reattach muscles so that she can walk properly? Like what's missing, if anything? Is there a patella? Is there a tibia? Is there a femur? Where are the ligaments that are present or not present? Because you can take donor grafts from other parts of the body and attach bones that way, but you need to know before you go in. Otherwise, the patient will be under anesthesia for way too long, and that's not ideal.
We will perform operations on both sides of your knees, the ankle joints, and the soles of your feet. Your soles are not flat, so we need to make them flat through operations.
She and her parents had to decide if it was worth risking surgery.
An important question everyone should ask undergoing surgery, because it's easy to fall into what we call routine procedures or routine surgery. Not blaming or throwing any specialty under the bus, but if a surgeon's job is to operate, they're gonna offer an operation. It's the surgeon's job to know when that's appropriate and not, but I say let's take it one level further and take the onus on ourselves to ask the question, is it important, and what happens if I don't go for surgery?
A few days later, she was brought to the OR for her first operation, where Dr. Chen attempted to straighten her right leg.
Yeah, so based on looking at this drawing, I could see that there's a very sharp angle between the femur and the tibia where they normally meet. They would have to literally cut the bone and maybe create an artificial joint or make use of the structures that already exist. Again, I'm not a surgeon nor an orthopedic surgeon, so I leave it up to specialists, subspecialists like this.
The operation is a long, complicated process that involves cutting a precisely measured triangular-shaped piece of bone from the back of Twingy's lower thigh.
We cut and remove this piece of bone, then adjust the thigh bone so it will become like this.
This is like when medicine, artistry, and engineering all coincide.
Just 3 weeks after entering the hospital, both of Twingy's legs are now straight. Each surgery is followed by several weeks of muscle rehabilitation to help her support her newly structured bones.
That type of muscular rehabilitation is gonna be of utmost importance, not just for increasing circulation to the area to help it heal, but also from a neuromuscular standpoint, so that she can learn to have good control over these muscles and the new motions they do. Because before, she's learned and taught those muscles to fire in a way that has to completely change. Like biomechanically, she has to change.
Twingy has 2 4-hour operations in 2 weeks. Her right foot is corrected first, and then her left. 3 weeks after the 4th operation, her feet and ankles are still supported by plaster casts. But Twingy takes her first proper steps.
That's amazing.
5 months after her final operation in Taiwan,
Which is not that long, 5 months.
she was 4'2", but has now gained 12 inches in height.
The best breakfast for you based on your zodiac sign. This is a meme, right? Like, this is not a Facebook health post. A Gemini should eat Raisin Bran. A Leo, it looks like a wrap from Dunkin' Donuts. This is absolutely redonkulous. Health benefits of dance. Boost memory, improve flexibility, reduce stress, increase anxiety, improve balance and posture.
You see the drippy, I fit it up. I put my car in the giddy up. Secure the bag, yeah, I get the buck.
Okay, look, is dance gonna boost your memory? Probably not. Is it gonna improve flexibility? Probably, because you gotta keep your hips moving. Anytime you go through a wide range of motion, you're gonna improve flexibility. Are you gonna reduce stress? Yeah, because it's awesome to dance. Are you gonna increase energy? Yeah, because you're exercising. Are you gonna improve balance and posture? Yeah, because look at these moves. I actually took some dance classes at the beginning of this year, and they got shut down because of COVID. My dance moves are awful because of COVID, and I'm sticking with that statement. How to calm a crying baby in 1 minute. Ooh, I like this. These pressure points will help to relax them. I'm scared where this is going. Head and teeth. Wait, whoa. It says head/teeth, and then they're pressing on the baby's toes. I don't know what's going on in this video. It already seems highly inaccurate. Chest, and then the foot lights up. Wait, I'm so confused. Don't listen to this. If a baby's crying, A, you need to figure out what could be going wrong. Are they hungry? Have they wet themselves? Is there a part of their body that's bothering them? And if you've checked all those things and you think your baby's all right, you should really try and move the baby around. You can run on one. Some people are born with just one kidney and live healthy lives. Can you live with one kidney? Absolutely. In fact, I know people who have donated a kidney to their loved one or a compatible match. Hold on, I believe Selena Gomez received a kidney from one of her friends. But you have to take really cautious steps once you only have one kidney. You really need to make sure you're well hydrated, you're not taking medications that could potentially harm your one kidney, because you are at higher risk for certain medical problems, obviously, because you don't have a backup kidney. Miracle cure. I already love the name of this page because we all need a miracle cure. Doesn't exist, but we all need one. Try these sleeping positions to improve your health. Well, why does it say try these sleeping positions when it says 2 out of 3 of those are wrong and only 1 of them is right? I don't like that sleeping position that much. I mean, for certain people, it might be comfortable. Keeping your arms like that elevated above your head can really cause some impingement issues, especially around your rotator cuff. Your rotator cuff is made up of 4 muscles that attach to your shoulder, really give it fine motor control. This is the infraspinatus, supraspinatus, teres minor, and subscapularis. Sometimes that one gets stuck in my head. When you have them in this position, that can sometimes put pressure there, decrease circulation. You wake up sort of with a dead arm. I'm not a huge fan of that position. Laying on the side is fine, laying on the back is fine if you have the right pillow and mattress combination. Ideally, you wanna have a firm enough bed where you have support so your back doesn't completely collapse, but not so firm that it puts pressure on you as a side sleeper into your shoulder, because that could also be quite uncomfortable. A little pro tip here, depending on how much you weigh will also play a role in the firmness that you experience from a mattress. If I, as someone who's 200 plus pounds, lay on a medium mattress, I might find it too soft because I'm heavier than if, let's say, my sister who's like 120 pounds lays on that same mattress. So always test them out if you have the option. 7 things about your tongue color can reveal about your health. Stick out your tongue for a quick health checkup. Before we start, know that these videos are almost never accurate because there's variations to human color, variations to organs, and there could be normal anatomical variations that this thing can't take into consideration. So it's bound to make huge generalizations which end up inaccurate. But let's see how inaccurate. Light pink. you are healthy. And they painted the tongue the color of a neon highlighter. If your tongue is the color of a pink neon highlighter, you're a cartoon, because I don't think I've ever seen that in a human body. Whoa, what a jump from pink. If your tongue is red, you might be suffering from an infectious disease. This is the definition of healthcare associated, health information associated anxiety. This is where we always make the joke, you go on WebMD, you find out you have cancer. This is the problem. The fact that this says your tongue is red, it means you have an infectious disease. This would scare the life out of me. If your tongue is a color that you're not used to seeing, talk to your doctor about it. Do not assume you have an infectious disease. Because honestly, I would look at my tongue and say that it's red right now, and I don't have an infectious disease, I promise. This is why beer is healthy. Whoa, whoa, whoa. Beer increases bone density. Beer has a high concentration of silicon, which helps to bind muscle and bone tissue together. It increases bone mass. Not 100% certain about silicon, whether it helps bind muscle and bone tissue together, but I will say that whatever ingredient in beer helps you have strong bones can most definitely be gotten from other sources without the need for alcohol. So already I'm gonna say this is moderate beer consumption lowers your risk of heart attack by 25 to 40.
Lies!
They probably found an awful, poor quality, uncontrolled study, and they're trying to draw conclusions from it. This is absolutely not true. In fact, the studies that we've used in the past to say that there is some benefit to drinking alcohols usually came from studies related to wine consumption, not beer. In fact, heavy drinking increases the risk of heart disease. Alcohol is actually cardiotoxic to the chambers of your heart, the muscles of your heart. It could actually cause dilated cardiomyopathy, where your heart becomes so enlarged that it's floppy and doesn't work well in pumping blood throughout your body. Enjoying a beer also helps increase the amount of healthy HDL cholesterol in your body. No, it does not lower your cholesterol level. Drinking beer often will increase your cholesterol level overall and cause more problems, leading to plaque formation, which is why having a high cholesterol is worse. So no, beer is not a solution for any of these problems thus far. Whenever I give advice about alcohol, my advice is always, if you don't need it, don't use it, because there's no real proven benefit from it. If you do use it, make sure you use it in the smallest amounts possible, so that if there is a potential benefit, you're maximizing that and minimizing the harms. Top 9 benefits of grounding. Oh, this is my buddy Mercola. Did you know that the energy from the earth can help you live a healthier life? Yeah, like if you go out into the sun, your body can create vitamin D, improves sleep quality, and promotes feelings of restfulness upon waking. Now I know. This whole time, my patients have been struggling with sleep. I should have just told them to go out for a walk on grass without their shoes on. Reduces muscle stiffness and soreness. I mean, these claims are just ridiculous. At least give me how that could happen. Like, are you gonna make a stretch and say there's an electrical charge leaving my body and it becomes one with the earth and that makes my muscles relax? Like, come on. Like, we have to be reasonable. I'm gonna summarize this video for you without lying. This is the honest version of this video. Hey, go outside and go for a walk in nature. And I guarantee you, because you're happier, because you're less stressed, you're breathing fresh air, you're seeing green all around you, which is actually more pleasing to the eye, you're gonna feel more relaxed. You're gonna have better health outcomes overall. You can keep your shoes on or take them off, whatever's most comfortable for you. And I don't need to promise you anything, because overall it's a healthy thing. Ooh, the best hangover cure. Just so you know, a hangover is usually oversimplified when we think about it. A hangover is all sort of different symptoms and simultaneous things that are happening within your body. Dehydration, alcohol intoxication, diarrhea, nausea, gastritis in the stomach. All these things are happening simultaneously. So a hangover is really a combination, a confluence of symptoms, if you will. If anyone knows how to cure a hangover, it would be a chef. No. If anyone would know how to cure a hangover, it would be a scientist. 2 ingredients, ice, 2 parts ferment, and 1 part what? My man's solution to hangover is to drink more alcohol. Yeah, if you're having alcohol withdrawal, it will ease your withdrawal symptoms, but that is not a cure by any means. Tastes like a minty pine cone. You know what? Sometimes I do wake up in the morning, I'm like, I wish I had a minty pine cone taste in my mouth right now. How is that pleasurable? Breaking courts discreetly confirm MMR vaccine causes. No, it doesn't. And that's not what the court confirmed. In fact, just today, there was a a medical article published from the Journal of American Medical Association. They looked at 5 countries, 2 million participants. They found 22,000 of them who were diagnosed with autism, which is 1 in 90. And they found that 80% of the autism cases were inherited. That means not due to vaccinations or anything external. That's so important to talk about because those who are anti-vaccine will hijack some of this misinformation and try and convince you of their points to scare you away from vaccines unnecessarily. This is about the truth. And if we're trying to do the best for our patients, we can't just go off of unproven hypotheses and theories. We need to look at the evidence. And there's been a study of 600,000 children who've been vaccinated, no link with autism found. This study with millions of people finding that autism 80% of the time is mainly inherited. These are important things to look at. Please do not fall for the misinformation that comes from a lot of these natural sources on Facebook. This is probably the worst form of misinformation on Facebook.
I'd call that a pretty fun weekend.
What's the Murtaugh list? Now, as the doctor, I need to see this list before I give the A-OK. I'm just kidding. That's not what a doctor's role is. A doctor's role is to warn you of risks and dangers and allow you to make the decision for yourself. That's called bodily autonomy. Oh, he's bleeding heavily. Most people that get their ear pierced don't bleed that much. I hope he didn't just stab himself in his cranium as well as going through his ear. The problem with ear infections, and it's not so much with an earlobe infection, it's more of a middle ear infection situation, is it can actually spread to the mastoid bone, which is attached to the occipital portion of your skull. And that area, the mastoid process, if it gets infected, it gets inflamed, it gets painful, and you require IV antibiotics. It's pretty ironic. So many parts of the body are called process, and that just means bone sticking out. Like a protruding bone is a process. So you have the mastoid process, you have the spinous process on the vertebrae. There's got to be another process that's going to come to mind. All of these. Just full-blown cellulitis requiring soft tissue antibiotics. You also might be having a reaction to the metal in that earring. That also happens a lot with nickel allergies. It's one of the most common metals to have an allergy to. People call it a cheap jewelry allergy. I think nickel's cool, so I don't call it cheap, but you know, to each their own.
Speaking of food, Marshall, I got some bad news. Just read online. Gazzola's is closing. No.
What's Gazzola's?
A filthy mecca of spectacular, if undercooked pizza located at 316 Kinsey Street, Chicago, Illinois.
New York pizza is the best pizza. Don't tell me otherwise, please and thank you. Brooklyn pizza, to be specific. Staten Island up there as well. And the only correct way to order a pizza is with extra cheese pepperoni. Don't tell me otherwise. Unless you're my cholesterol, then you're allowed to tell me otherwise.
Those Gazzola's trips, that's where we really became bros.
We ate nothing but jerky.
Drank nothing but Tantrum.
Tantrum was a soft drink with the highest caffeine content legally available over the counter.
Oh my God. This reminds me of Prime, with the Prime Energy having a huge amount of caffeine content and how it's being marketed to kids and how that turned out to be a huge disaster. It actually also reminds me more of Four Loko. That was a problem. People are getting palpitations. They were getting sick off Four Loko. And for those who don't know, Four Loko was like an alcoholic beverage that wasn't incredibly high in alcohol content, but it had some, but also had a mega amount of caffeine. And it was also huge serving size too.
Those trips were brutal, right? The long hours in the car, the motion sickness, the smell.
So what time are we leaving for Gazzola's tomorrow?
I was thinking 9:30. A little rubbery, room temperature, kind of gross.
Making me wonder if this pizza is worth the 22-hour drive.
22-hour drive. That's a blood clot if I ever heard one. I'm just kidding. But that does put you at risk for having a blood clot. Long drives, long flights, post-surgery. If you don't move, you have a higher chance of having a clot form in the veins of your legs. Because actually, when you move around and you take steps, your calf muscle squeezes, therefore it helps some of the blood flow from the veins come back up. But if that blood pools and stagnates in the area because you're not using your calf and pumping well, as a result, you could form a blood clot. The danger of having that blood clot is having that blood clot get loose from that area, get shot up into your circulation, into your lungs, creating what's known as a pulmonary embolism. Because it lodges in your lungs, blocks blood flow, and the lung dies.
Just like old times.
I feel so young again, except for the chest pains.
You know what's funny about pizza is it's one of those foods that is really like a triple whammy in terms of potentially being unhealthy. You consume a lot of sugar that can lead to high triglycerides, higher blood sugar levels, cells, which can increase inflammation in the body, all sorts of vascular issues, vascular inflammation. But then on top of it, you have high sodium content, which can increase blood pressure. Then on top of it, you add high fat content, which can raise your cholesterol, leading to blockages being formed. So you have like blockages plus inflammation plus high blood pressure. A lot of strain on the heart and kidney. I still love pizza. This isn't a pizza hate video, I'm just saying.
Got my stomach!
Ooh.
Damn you, Cazolas!
Oh, food poisoning is terrible.
It's like a hot ball of lead! Baby, cut it out of me! Cut it out!
You know what's funny? When we study in med school specific foods, reheated pizza is not one of them, but there's certain ones that they test us that they ingrain the types of bacteria that those foods tend to harbor and then cause illness with. So like reheated rice has B. cereus bacteria. Potato salad has like salmonella. Deli meats have listeria. We even have some for animals. Like if you own rabbits, maybe you have tularemia. If you have parrots, maybe you have chlamydia. I'm not exaggerating that. That's like still ingrained in my head from the medical boards.
130, what? You...
They didn't have Uber back then.
I'm Batman.
He got hit by a bus.
BTW, there's one bone downstairs that ain't broken.
That's not a bone.
Up top.
Are you sure?
Yeah, dude. Why do you think I had him set it this way?
Okay.
Oh, that's kind of hurt. You know what's funny? He's wearing this C-spine collar. We wear that usually to stabilize the C-spine until we clear it, until we get proof that there's no fractures or danger to the cervical spine. And it's very clear since he's been bandaged up and he has casting on that the x-rays are already complete. So that thing would have come off by now. It's also really important when you have casts on the lower limb to keep them elevated to allow the lymphatic fluid to drain and not allow it to swell, because if it swells, pressure can build up and it can create all sorts of problems.
I had to look away because if I watched what the paramedics were about to do, I would have passed out. Then they took out this electric blade thing, and I kept thinking, this isn't happening, this isn't happening.
The electric blade thing is probably an oscillating saw to take off a cast.
Oh my God, what did they cut?
My suit.
Oh.
My beautiful suit.
It's actually really cool if you've ever seen a cast saw. If you put it on your skin that's soft, it kind of just bounces your skin around. But if you put it on a cast, which is a surface that's hard without elasticity, it's actually gonna cut through the cast because it vibrates so hard. There's actually some really cool slow-mo footage. Here, maybe we can play it.
I'm afraid you're allergic to lobster. You can never, ever, ever have it.
Is it lobster or just shellfish in general? Which is usually somehow tied to iodine. Is that like the white bear principle where it's like, or white elephant, where I say, don't think about a white elephant, and you're definitely gonna think about a white elephant? Oh man, that's serious angioedema. I'm worried at this moment because she doesn't have an EpiPen. We could get into trouble. You know, there's actually immunotherapy that you could do with like sublingual tablets or injections that can help overcome an allergy. Pretty cool stuff.
I don't need to go to a heart doctor. I drink every day, I sleep 3 hours every night, and I have multiple sex partners. I'm doing everything right.
Well, not sleeping is not great for the heart, especially long term, because that puts you into sympathetic overdrive where you're in fight or flight mode, which means you have high cortisol, you have high blood sugar, you have dysregulation of your blood pressure, then you're drinking large amounts of alcohol, which is cardiotoxic. Yes, alcohol is cardiotoxic. Sexual partners, probably the one that contributes the least to the heart. I guess if you're having lots of sex, it's like you're exercising a decent amount, so maybe your heart healthy for that reason.
Well, Barney, your heart sounds fine.
See, Lily? She was worried.
Although it seems like you might have a slight arrhythmia.
I'm assuming he's gonna have like a PVC.
I'd like you to wear this heart monitor for the next 24 hours.
It's called a Holter monitor. We have patients wear it for 24, 48 hours if they're having symptomatic arrhythmias or we find an incidental arrhythmia. What's cool about the monitor is obviously it's an older one. The newer ones, they have like a little connection to your phone where if you're experiencing some of the symptoms like palpitations or pain or something, you could press a button on the phone, which actually marks the area of the electrical rhythm when you're experiencing it. Because some patients may come see me and they say, I feel fine right now, but sometimes, doctor, something's going on in there. What's cool is with the Holter monitor, I can actually go back in time and look at the moment where they pressed the button, what was going on with the heart.
Flag on the play, Doc. I have a date tonight.
Don't worry, it's totally safe. Unless part of your big date involves connecting yourself to a car battery.
Well, now it doesn't.
That was like a really weird choice of humor. I don't know. I don't get it.
Okay, everything looks fine here, although I did notice a few irregularities. There's nothing to be alarmed about.
She's probably pointing out PVCs, which are premature ventricular contractions. Not incredibly scary, especially if they're asymptomatic, meaning you don't feel anything with them. Young people can have them. They kind of just pop up because sometimes treating them or trying to treat them will actually lead to more complications as opposed to just leaving them alone.
Nora's great. She's wonderful. But
What time was your dinner reservation?
last night, 8:30.
What did his heart do at 8:30?
It literally skipped a beat.
That's cute.
Your heart's talking to you, Barney.
Oh, he
Do you have the
loves
guts to listen to it?
Oh my God, does he have heart block? If he has like a 2nd-degree heart block, Mobitz, I'm paying attention.
What do you mean I can't have an epidural?
You're too far along. Things are moving much faster than expected.
Look, if your hands are tied medically, just leave the epidural on the table and walk away.
How are you gonna put it into your spine?
Lily, I know this isn't how you imagined it, but I want you to know that I am here for you and I am rock solid. Oh, I can see its head. Oh, thank God, Dr. Sonia!
You! Get that thing out of my delivery room!
Where are the nurses? Where is the support staff?
We push now, yes?
I can't, Marshall's not here yet.
Lily, if you don't push, I will shove that baby up your throat and pull it out of your mouth!
Yeah, we don't do that, sorry.
Everybody?
Oh, that baby's like a month old.
Named him after my pop.
Maybe not a month.
Tell them the full name.
Where do they get babies from for TV shows? Like young babies. Do people rent them?
I think young babies literally have.
See what he's up to. See how the penny challenge is coming along. Let's watch some Ryan Trahan content. Be-woo!
50 hours starts now.
50 hours in darkness. That's serious.
It is completely dark in this house. Blackout curtains, all of the lights have been covered up.
The way your body adapts to darkness is by allowing your iris to relax the muscle surrounding your pupil, opens it up right there. Your pupil's wide, allows maximum light to come in. Remember, it's the rods in your eyes that are responsible for night vision, darkness vision. But if you want to have perfect adaptation to darkness, it takes a few hours. Oh, that's gonna be an injury. He needs a doctor. I'm here for you, Ryan.
As you guys know, let's take no days off around here.
Working out in the dark is not medically recommended. That could potentially cause a lot of injuries. See, I wouldn't do this with weights. I would just do the like body weight exercises. Push-ups, crunches, squats, lunges, that sort of thing.
Nighttime routine. Haley actually got me a bunch of new skincare, so I look forward to my nighttime routine.
How did he know that was his toothpaste? Something about that is fishy. If you have a nighttime bag with a bunch of creams and stuff, how'd you know that was toothpaste? Oh.
That's facial cleanser.
How did he know that that was facial cleanser? The security camera caught me at 3 a.m. I don't remember. Oh, sleepwalking. That's funny. This is actually fairly common. Not eating 5 bags of fruit snacks. Sleepwalking happens during the non-REM phase of your sleep. Usually happens an hour or two in. It's one of the deepest, it's the deepest stage of your sleep. People don't remember it. Usually someone else has to alert them that it's happening. And studies show like 1 in 2 people get injured sleepwalking. Could be a minor injury, but they still do get injured. You wanna make sure that if that's happening, you figure out the underlying reason as to why. Stress is one of the leading factors.
Right about now is when time just completely stopped being a thing for me.
So not having exposure to light can actually break your circadian rhythm, your natural circadian rhythm of when you wake up, when you go to sleep, because there's sensors in your brain, your eye, that get triggered by light entering. So that's why I always say that one of the first things you should do in the morning upon waking is opening shades, getting bright light. And I know not every area in the world has access to that. So you could fake it with some artificial light. Testing if I'm still lactose intolerant. Oh, this is gonna be a brutal test. You know, it's funny, a lot of patients will come see me in the hospital and be like, am I lactose intolerant? I'm like, if you drink a quart of milk, do you have massive diarrhea? That's your answer.
Plowed a slice of cheese, and then I ate yogurt and butter and cream cheese, and I remembered I didn't
Why
even
is
like
he
most
doing
of it. And finally demolished a cup of milk. Now we wait. I was waiting for about 30 minutes when the unimaginable happened. I sprinted to the bathroom, and my chihuahua was sitting on the toilet.
That's a chihuahua? That's a hairy chihuahua.
And I'm still lactose intolerant.
Yeah, that's a lot of diarrhea. Can only imagine the sounds that came out of that bathroom.
Do you overcome a lactose intolerance?
Some individuals can eat certain dairy products. Some can drink milk, lactate, and some can take supplements, like a lactase supplement. Doesn't work for everybody though.
I don't think you realize how crazy the world's quietest room really is. Apparently 30 minutes inside will drive you completely insane.
I've never learned that in medical school.
For reference, a school cafeteria is roughly 100 decibels. A football game, 125 decibels. That's really loud. And the world's quietest room, must be so quiet. It's -9 decibels.
How do they pull out decibels?
What you'll begin to experience right away is the sounds of your ears. When you're in super quiet, you begin to hear buzzes and whooshes.
Blood flow.
By a half an hour, you'll hear your heart easily. You'll hear your ears getting louder. You can hear the joints in your arms and legs.
So far I've heard all of the things he's mentioned, but now I think I'm hearing blood flowing to my brain.
That happens.
What do you think would be harder? 1 hour in the world's quietest room or 1 hour in the world's loudest room?
The world's loudest room? Why would you do that? You're gonna hurt your hearing.
The reverb room reflects each note and distorts it so much that the music eventually just becomes an awful, never-ending screeching noise.
Wow, that's cool.
A reverb room is a room that's pretty close to 100% reflective, and so no matter where you are in a reverb room, it doesn't get any louder or any quieter. It's a perfectly diffuse room, which means the sound is the same everywhere.
That's terrible. He's gonna lose his hearing.
Oh my gosh.
You could permanently damage your hearing like that.
I just damaged my ears. Can noise make a dude die? Yeah, it can. Apparently the European Space Agency has a sound weapon that if they wanted to, it could put you in a coffin.
Well, there's LRAD devices that are used for crowd control purposes. It does make people physiologically ill.
I just put on this sauna suit, I am drenched.
Well, people use sauna suits for cutting weight, specifically wrestling, boxing, MMA, that sort of thing. Not a huge fan of it. In fact, I wish the sports would change the way the weigh-ins are done to be done on the same day so people don't cut weight.
I'm gonna be wearing this for 24 hours straight. I live in Texas. That sun right there, absolutely.
Oh, that's dangerous. You could easily not only dehydrate, but develop heat stroke, which heat stroke is deadly, like legitimately deadly.
Is it a 24-hour challenge?
Yeah.
Have you consulted a doctor?
Haley, I called the doctor.
I'm right here, bro. Just call me.
Dr. Mike.
The doctor's on call.
I need to ask you what you think of this, all right?
I'm feeling the outfit. It looks fire. Is that the new Versace line? The worst joke ever. How did I think that was funny? That's clearly Gucci. Medically, it's not safe.
Oh, dear.
Because unlike going into a sauna where you sweat and your sweat can actually evaporate, thereby cool you off, that sauna suit will prevent the cooling off process. That guy knows what he's talking about. So you will sweat, you will become dehydrated, you would lose some electrolytes, and you will overheat.
You better go get some water, huh?
And not just water, electrolytes.
I lift up my arm and a massive pool of sweat trickles down my armpit and into my nether region.
Fungus! I've went in a sensory deprivation tank and did a whole video on this. It's silent, it's dark, and you're floating. Kind of feels like an alien movie.
I'm gonna be doing the maximum legal time in this thing, 3 hours. One with no gravity, one with no gravity or light, and one with no gravity, light, or sound. Complete sensory deprivation, which apparently can have some side effects.
Yeah, those things can happen, but there's a lot of good effects as well that can happen. I will say, going to these sensory deprivation things, my biggest issue with them is that they make way too many promises as if they're certified. 1 hour in a sensory deprivation tank is equivalent to X number of years of meditating, which is nonsense. Making promises about rejuvenating one's immune system or sleep cycle, like taking a break from your phone is beneficial. Being alone with your thoughts is beneficial, but making crazy health promises? Too far.
You guys know I can't swim, really. Well, I can't float either. I am negative buoyant somehow. So these pools have tons of salt, like 2,500 pounds of salt. And salt makes you float.
It does make you float. It also makes it a problem if your eyes if the water gets into your eyes. They usually give you like a little floating pillow as well. And I remember the one that I went to had like an emergency escape button to call for help.
Around 2 hours and 4 minutes-ish is where something actually crazy happened. I really feel like my mind was the only thing working at this point. I suddenly felt like I infiltrated this memory that I haven't thought of in years because I felt so still.
Well, for me, I had a similar experience, and then I would start like seeing different colors and brainstorming much further than I usually do.
This was my body while running 80 miles per week and eating 3,000 calories a day.
Yo, my man is ripped, and he's running 80 miles a week? Woo-wee!
This was my body while only lifting weights and eating 4,000 calories a day.
Well, yeah, if you eat a lot of calories and only lift weights, that could be a problem. I mean, it depends what kind of calories you're consuming. Remember, macronutrients matter here.
I wanted to know what would happen if I only do bodyweight workouts in virtual reality. Yeah, VR, for 30 days while on a strict diet of 2,000 daily calories and a goal of having fun.
Well, that's an important goal because when you're trying to change your body, if you're not having fun, it's gonna be temporary. You wanna develop good habits here.
It's day 1 and it's time for weigh-in. All right, here we go. See, 157.7.
Ideally, you wanna do that in the morning with no clothes on to get the most accurate measurement after you've peed and pooped.
Oh my God, dude!
Oh,
what the?
Is this Beat Saber? Oh, this is giving me a headache.
What the heck is this?
By the way, I've played these VR games. I get so dizzy.
This is actually so scary. What's up, boy? Get back!
Oh my God. Oh my God. Are we gonna have Ryan Trahan on Creator Clash 2? Day 12, he's eating a burger.
Out of everything, the diet is the hardest part.
Diet is the hardest part, and it's the most important part when changing how you look.
Oh my gosh, 150 flat. So here's the before and after. Honestly, I would give most of the credit to my transformation to the diet.
Of course, you cut down from eating 4,000 to 2,000. That makes sense.
This is a penny.
1 penny challenge time.
And I'm gonna use it across America in the next 30 days.
And he's coming to see Jimmy.
Rule number 1, all profit must come from the penny.
All power must come from the penny.
Big overarching goal for this series is to raise 1 million meals with Feeding America.
He does it. We did it.
I look like Mr. Krabs.
My man got sunburned already. Put some sunblock on, dude. Even if you use sunburns throughout your lifetime, increases risk for skin cancer. You're out in the sun, put on sunblock, Ryan. I'm only yelling because I care about your health and I don't want you to get skin cancer. By the way, sunblock is not the #1 protection against the sun. It's shade.
But if you want to donate the incentives, this.
Yeah. 100,000.
McDonald's. I'm gonna treat myself to a deluxe breakfast this morning.
Well, see, this is like the unfortunate reality of the United States. Like, if you want to save money, eat cheap, you oftentimes have to eat unhealthy.
Chipotle.
Oh, I love Chipotle.
Oh my God, I love Chipotle. Chipotle is my life.
By the way, something I never say, and I probably should, Chipotle always hooks up my graduating residents for their party with like a catered Chipotle meal for free, because that's awesome of them.
I'm gonna take a break and eat a burrito.
My order is usually a burrito bowl. Brown rice, black beans, chicken, fajita vegetables, romaine lettuce, the non-spicy tomato thingy. What is it called? Salsa? Oh, and guac.
McDouble, maybe? Okay. Cool. Can I just get that with cheese and ketchup only?
This is not a healthy way to eat. Please find healthier ways to eat, Ryan. I care about your health. We need the veggies.
Can I get 2 McChickens with no vegetables?
No vegetables! You're gonna pay for that.
With white rice, chicken, and shredded cheese. White rice, chicken, and cheese.
Dude, fiber. There's veggies right there. They're fresh. They don't even cost extra. We're gonna get Ryan to eat some veggies. You know.
So last night before bed, I went to Ralph's. I went to a grocery store, and we got goldfish, rainbow goldfish, protein bars.
What kind of protein bars are those? Fudge graham? A lot of sugar alcohols in those bad boys. Or like some kind of artificial sweeteners leading to terrible diarrhea. What a sugar alcohol is, just so people understand. It tastes like sugar, similar to sugar in that it's sweet, but then your body can't absorb it. So if you don't absorb it, those large molecules hang out in your intestines and then through osmotic pressure suck in water. And then as a result, you have lots of diarrhea. Did he just order tuna and rice?
Oh yeah.
How is the solution to his issue?
Ayo, tuna and rice, Jay.
Can you at least get a fruit, bro? Just for God's sakes, eat a berry. The 1 penny man himself. What's up, buddy?
Dr. Mike, you're amazing, dude.
No, dude, you're amazing. And you're looking a little bit disheveled, I gotta say. What's going on, buddy?
I'm delivering burritos on the highway.
I hope you're being careful, because, you know, as a doctor, I have to preach safety here for you.
I found a bike lane. We're good.
How is the journey so far?
It's been the craziest thing I've ever done in my life. It's day 19 right now, but it's been so fun, so rewarding. Can't believe the generosity that I've seen. It's been so inspiring. My heart is so full right now.
Dude, you had a goal of 100,000 and now you've already crushed that goal. What's the new goal? You have to have a new goal in mind.
New goal is $1 million.
I think you're pretty close. I think you're like very close to that, aren't you?
We're getting there. We're getting there. It's very realistic, which is insane at this point.
I will say, watching your vlog, I was a little bit upset and nervous for you at the same time. What's going on with the veggies, man? You don't like veggies?
I don't like vegetables. I have to take like supplements for vitamins because I don't eat many vegetables.
The natural form is better, man. Like, well, okay, I won't harp too hard on the veggies thing, and you'll see why in a minute or so. But the next thing is, I gotta get you to wear sunblock because in that first video, you got burned. I hope you're wearing sunblock now.
I got some, Dr. Mike.
But you must be getting into ridiculous shape. You're biking every day for how many hours?
I have an Oura ring that's tracking my daily calorie input, and I'm hitting like 4,500 calories burned a day, which is insane. 20 miles of walking, 25 miles of biking a day. It's gnarly.
I know that the perk of donating over $100,000 was that you will be willing to get a tattoo done by that person's choice of tattoo.
That's right.
And to make it interesting, I've come up with 4 options for you.
Ooh, okay.
Those options are not really for you. Those 4 options are for the fans to choose. And I'm gonna put up a poll of the 4 options, but I will give you an opportunity right now to sway the vote in any way that you want it to go.
Okay.
Are you ready to hear the 4 options?
I'm so ready, Dr. Mike.
Option number 1, this is the most heartfelt one. You will get tattooed on your body a QR code that anyone can scan and donate to the charity of your choice at any time.
That's amazing. I actually like that. That's not bad at all.
Number 2, this one is personal to me, and it's some piece of advice that is not only good for you especially, but also for the rest of the world. Eat your veggies. So you're gonna get a tattoo that says "Eat your veggies."
That's amazing. Okay.
To help remind you and remind the world how important it is to eat vegetables.
Yeah, I think so. I need to see that on my body every morning.
This one is in memory of the penny challenge, with the goal of your penny challenge all in one. Option 3. What do you think about that?
Oh my gosh! Please no. I really hope it's not that one.
We've redesigned the penny to say "In subs we trust" with good old Jimmy on the penny.
Oh gosh, that's so funny. Getting Mr. Beast on my body forever.
How would you feel about that? How'd you feel if you had to rock that?
Less excited about than the others.
And the next one is one that is kind of evil. You're not gonna like this one.
Oh no.
But if your fans are very angry, they might give you this one.
Okay.
We kind of gave you a basic tattoo idea. One that incorporates everything that you've seen in every basic tattoo ever. And this was actually hand-drawn by Call Me Chris of TikTok fame and YouTube fame.
Amazing.
Live, laugh, love to infinity with the dolphin and the butterfly wings.
That is so funny. Oh my gosh, that's hilarious. That might be one of the best ones.
Wait, no way, you like this one? I thought you would hate this.
I'm goofy with it. I think that's hilarious.
Which one do you want people to vote for?
I desperately want for everyone, because of my health in the future, eat your veggies. That'd be a great one for me. I would get the reminder daily, and I might actually start eating them.
You heard it here from Ryan himself, the one penny man, but we'll see what the audience decides.
Amazing, Dr. Mike. Let me know. I love you so much. Thank you for the generosity. This is so exciting.
Of course, man. Good luck. Most importantly, please stay safe out there. We want you in one piece, especially with all the good that you're doing. Thank you, man. Be well.
Awesome. Thanks, Dr. Mike. Take care.
Talk soon. Remember, you get to choose Ryan Trahan's tattoo that will live on his body for the rest of his life. The 4 options are right here. The link is down below to vote. It's basically my Twitter, so you can just head on to my Twitter and vote. Choose if you want to go with what he wants. You want to go with.
This is my first time. I don't know how to do this. It's, woo! Golly, I ain't trying to do that. This is questionable.
This is questionable. Honestly, the first time you do an ultrasound, it is confusing. I can relate to that struggle. And that jelly, it's just so cold when it hits the bare skin.
Doctor, something's wrong with me. Explain to me what's wrong. When I touch my head, it hurts. When I touch my nose, it hurts. When I touch my elbow, it hurts. I now see your problem. Oh no, am I gonna die? No. Your finger's broken.
I did not expect that. People are so much wittier than I am. That's so good. I thought she was gonna make a joke about fibromyalgia and I was gonna get upset, like you shouldn't make fun of patients. And she said your finger hurts. That's really good. Also, there's a play on that doctor's joke where it's like, doctor, it hurts when I do this. Oh, okay, don't do this. Copay?
Hi, I'm Dr. Jones. I'm an OBGYN physician. I'll tell you what I did today, but you have to listen fast. I put on a mask because COVID. I got some coffee because I'm addicted to caffeine. After that, I went to the operating room and did 2 surgeries, 1 major, 1 minor, before having socially distanced chips for lunch and doing an HSG. I'll tell you what that is another day. I went to my clinic and saw patients, pregnant and not pregnant, and then I went to my office and I charted forever. And then I went to labor and delivery and we delivered a baby and it was super fun, and now I'm going home because I'm exhausted.
Mama Dr. Jones is a champ, not only because of everything she does in her life and doing it quite well, she's amazing at TikTok. It's a really good representation of how hard it is to be a doctor, especially one who's seeing patients in a clinic setting but also is a surgeon. It's not an easy life. Mama Dr. Jones is up to the challenge. If you haven't seen our collab, I'm linking it down below.
Bro, sorry, bro. Your dad is dead. Oh, man. Calm down, man. I'm the one that should be upset. I had to go on break right after. You know how hard it is to eat a sloppy Joe after seeing blood? Did he go quick? Oh, no. He took his time. I'm like, hurry up. I'm trying to go on break. He fighting. I'm like, let go, man. You got God on hold, man. Did he suffer? Oh, most definitely, because he was screaming. I'm like, man, this is annoying, because I know the other patient's trying to sleep. I'm on the phone trying to talk to my insurance agency, trying to get my insurance lowered, but he yelling, they can't hear me. I'm like, shut up. If it makes you feel better, I'm sure Mr. Johnson is in a better place. Wait, my dad's last name is Wilson. Oh, your last name Wilson? Oh, my fault. Your dad is straight, bro. He outside. Hey, you Mr. Johnson's son? Yeah. Your dad is dead. Oh, thank you. You're welcome.
That was rough. I have to say, name mistakes in hospitals do happen. Like, this is a real issue. In fact, when we have 2 people, either with the same last name or a last name that sounds similar, we put on our floors name alerts. Like, it says name alert above the patient's bed and when you enter the room, so that these mistakes don't happen. And when people are creating the person's chart, it has a name alert on it. It's like a bright sticker so that you're checking the right person's name.
Hey, doctor, what's that thing? Great question, young man. That would be the heart.
Hey, doc. Scalpel. Of course. Doctor, I was wondering if that was the right coronary artery?
No, that is the circumflex artery. Get out of the OR.
Some doctors, especially surgeons, can be quite mean to residents and students, but they're really nice to those who are shadowing, trying to decide whether or not they want to go into the field because they don't want to scare them away. Plus, it's also fair to say that they're under no obligation to know all the important arteries. That person did ask what that is, and it was the heart. The one thing that I will say with quite certainty, and it's all jokes aside, is we need to end that toxic culture of like attacking residents and students, that if they don't know something, they're dumb or they're evil, or we need to kick them out. That doesn't really work. It doesn't motivate you to do better. It actually kind of puts you down and demotivates you. It's no good for anybody.
My Harvard days were my peak. God, those days were fun.
Dr. Welch, where'd you go to medical school?
I actually didn't go to school. Learned everything I know through YouTube tutorials and ebooks. No, I'm serious. Like, I literally don't have a legal medical degree. Because everything that I was learning in school, I was like, I can just learn this on my own. So that's what I did. I studied on my own and I worked on cadavers out of my garage. I'm like the Mark Zuckerberg of doctor people.
Where did you get cadavers?
And how are you the medical director at a children's hospital? It's illegal to operate without a license.
Is it illegal to save a dying child's life?
Yeah, for you it is.
Dr. Welsh, where did you get cadavers?
I don't blame you guys for not understanding, because you guys haven't seen the amount of Ty Lopez courses that I've seen.
He said Ty Lopez courses. Oh my God. Honestly, there's a lot you can learn online, and I feel like I'm about to release some merch soon, some limited edition merch, about how much education you can get online specifically from watching my videos. But so far, this is hilarious. Let's keep playing.
Knowledge will take you so far in life without a college degree. For example, every child that I save represents a new Lamborghini that comes into my life, which is why I have 43 Lamborghinis in my garage.
You took Ty Lopez courses to learn how to be an open heart surgeon?
Gary Vaynerchuk was also a very large influence.
The president's daughter has a punctured aorta. You two, sit the down. Dr. Welch, get in that operating room and save the president's daughter's life.
This is fun. Yeah, medicine is one of those things where, why am I even explaining this? Yeah, you can't practice medicine without a license. And it's not because like the license is some kind of magical paper that actually proves you're capable. But when you're about to trust someone with your health, you hope that they've been experienced, they've practiced, they've learned, they showed competency in these fields. So yeah, you want someone who's not only showing you a medical school diploma, but also a residency graduation certificate, a board certification. Like, I'm board certified in family medicine. I have a medical license in New York and New Jersey. They ask you a lot of questions about criminal backgrounds. Where did this guy get a cadaver?
Yeah. Ready. All right, be there in a second.
Your patient is waiting. Oh, my bad.
No. As funny as that is, that's not what happens. Dude, if we sat and watched SpongeBob or whatever for 45 minutes before going to see patients, we would be 5 hours late to each patient. Think about it this way. I go into a room with the patient. Technically, I'm scheduled for 15 minutes. My nurse has to be in there for the first 5 minutes, gathering the chief complaint, asking some basic questions, doing the vitals. That's 5 minutes. Now I have 10 minutes with the patient. Let's say I walk in exactly on time. I introduce myself to the patient. I ask them what they're here for. I ask them their name. I do a proper greeting to make sure that we're on the same page. I ask them what's bothering them. I ask them follow-up questions. I figure out how long it's been an issue, what other things run in their family. I look at their prescription medications. I decide to do a physical exam, do a few things to make sure I'm ruling out conditions that could be otherwise threatening to their health, and to figure out what exactly I think could be going on. I then sit onto the computer and I explain to them what is going on. I explain to them my treatment plan. I make sure they understand. I have them repeat back to me the same set of instructions so we're on the same page. I then place the orders in the computer so that they have their medications ready or treatment ready when they leave the office. I then go back to my area waiting to see the next patient. How much time do you think has gone by? I didn't even begin to write this patient's note. And I can't really wait to do it at the end of the day because then I'll get home way later than I'm supposed to, and everyone's mad because I'm missing schedules, I'm being late to the next patient, and it creates a huge hurdle. The amount of administrative work that doctors now have to do is beyond anyone's imagination. Like spending 30 minutes making sure that my patient gets their medication because I ordered capsules instead of tablets happens way too often. That's why we're late. Not because we're watching SpongeBob. Although that is cuter and funnier to think about.
All right, so Chad, it looks like you have a minor tear in your bicep. Nothing too severe, but we're gonna have you take about a month off from any physical activities. We'll bring you back in, we'll reevaluate you, and then we'll clear you based off of how well you've recovered. Okay? Sounds good? Awesome. Ha! Month off! Does he not know who I am? Ha ha! Idiot! Ah!
The funny part is I love that he's a Bengals fan. Shout out Cincinnati folks. This happens a lot. Most commonly where it's happened is around sporting events. Like if someone's training for the New York City Marathon and they come in with a serious injury, sometimes even with something really serious like a stress fracture, I'm like, do not run under any circumstances because you could fracture your shin bone completely. And people are just like, I don't care. I've been training so long, I'm doing it. That's obviously against medical advice. Usually they end up hurting themselves. Bicep injuries, oof, those can be quite painful. A minor one, yeah, no big deal. But I've seen bicep tears where the bicep actually ends up like up here. That